privacy. Be informed with IT. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Good morning, Guam. Good morning, Guam. got a feeling a lot of us are reaching deep this morning as you watched the news last night. Now the trajectory, they're saying way off September, October. We're going to get to that. There's always a lot to get to here on Containing COVID. It's the KUAM News Takeover, Guam's favorite. Good morning, Sabrina.
Good morning, Christopher.
It is 6:17. Good morning, Guam. CNMI and beyond, of course, to our Facebook Live viewers and listeners. Thank you guys for tuning in and watching from all over the mainland American states and even internationally. Thank you guys. It's 6:17, and there are just so many ways to help us contain COVID. Remember, we got the power to kill the curve. And it starts right here on the radio, 93.9 FM, Hagatna, Guam. It is Guam's favorite, I-94. Thank you to Andy Wheeler and the I-94 family for allowing us to move in here, hopefully temporarily, but temporarily seems to be getting more permanent.
I know, right?
We're also streaming live at KUAM.com and the KUAM News app. There's an audio stream on Docomo Channel 10. And then at 8 a.m., we jump over to KUAM TV 11 and bring you the last half of the show. And we do got some good guests for that last half to include the Adjutant General, Esther Agagi, will be calling in. Also, we're going to hear from Superintendent of the Guam Department of Education, John Fernandez, and many others here chiming in on containing COVID, of course. It's brought to you by Ambrose IT&E and Calvo Enterprises, 618. As we do, we start the show with a deep dive into the day's COVID-19 news from the KUAM News team, Sabrina Salas-Matanani. Good morning, Sabrina.
Holiday and good morning, everyone. According to the latest from the Joint Information Center, their latest release issued at 10:05 p.m., the Department of Public Health and Social Services tested 42 individuals for COVID-19 on Tuesday. 0 tested positive through public health and 42 tested negative. Public Health's overall count also includes probable cases of COVID-19 and confirmed positive cases by the Naval Health Research Center in San Diego, GMH, and DLS. To date, 136 cases have been confirmed through COVID-19 testing, with 5 deaths and 114 recoveries. The Department of Public Health will launch a community testing pilot program in Estumbo Dededo on Saturday. Here is Adriana Cotero from Tuesday's press conference requesting more information from Public Health Director Linda DeNorsi.
Moving forward. So because of that, FEMA recognizes our efforts. And so they readjusted our trajectory to saying that at the peak we would need about 40 bed capacity.
I have a question for Linda on the community testing. Can you provide further details on the pilot project beginning this Saturday in Estumbo, a rundown of how it will operate, and then when expanding, how will the pockets of village areas be determined? Will village mayors be part of this process to identify high-risk populations? As they just found out last week, Friday, how many COVID positives are even in the village? And then how will people be receiving info on the community COVID testing altogether?
Yes, right now, as I speak, we had a planning committee that we mobilized, which includes public health and, of course, the other, the mayor's council. Our representative was Mayor Savares. And we looked at all the details in terms of how the swaps are going to be done, and are we going to have the perimeters, making certain that it is well secured, making sure that we also have an ambulance there should anybody have any emergencies at that time. We're looking at a drive-through towards that perimeter that we are identifying, and looking at just like you said, a pilot study. We're looking at a small sample size to start off with. And what we're trying to do is we're trying to involve not only the department, but also other agencies that will be involved in this project, as you know. Of course, working with the Physicians Advisory Council and all this, so that we're all in line in terms of identifying and moving towards, of course, these pocket areas that you're identifying. We are working with the mayor's council, and we're looking at representatives of all this area. But I'm just going to elaborate for now on the pilot project that you're asking. And again, we're launching it so that it will meet our sample size. As you know, Dedido is a highly populated area. It also has high risks involved in the patients that are there. And we're looking at mild illnesses, patients that come in. We're doing case findings. That's what we're really focusing on. As you know, we're continuing our efforts with identifying the clinics to expand, and that will continue, whether they are seen at the private clinics, at the public health clinics, or even at the hospitals, both GMH and GRMC. In this particular case, it's case findings, and that's what we're elaborating on so that we can identify these mild cases, and they will eventually present themselves. We will notify the the targeted group, and that will be done so that they know what form they're going to fill up and be prepared in having that form completed, and they will be notified through a flyer that will be distributed to them, and we're getting the mayors to be involved in that process. And so that, in a nutshell, is the activity. And of course, working with other government of Guam agencies and the TAC, the National Guard, to maintain the perimeters, ensuring security, and so forth. And so that's where we're at. And as the governor had indicated, that's what we're gonna do, as she had indicated.
So just following up on, Governor,
I just wanted to ask if Dr. Cruz can chime in and how we're gonna work together cohesively so that we move forward and end up being in line, and again, going to identify other individuals.
So this pilot study is going to proceed, but it's going to be a part of a larger overall community testing protocol that's going to be marched out. We have, again, as Linda stated, a planning session this afternoon with the Physician Advisory Council Committee, along with public health officials. And so she's going to identify this one pilot study, but we also want to make sure that the vulnerable populations, those are the, as the governor stated, multi-generational, multi-family homes, end-stage renal patients, those with significant comorbidities, frequent flyers to the hospital that we know that are coming back and forth to different hospitals, to either GRMC or GMH. These are vulnerable populations that if we don't identify and make sure that there's not a cluster or a positive within those particular communities, they will in fact be the ones that are going to overwhelm our healthcare system, especially the intensive care unit. So again, as we do this, there's going to be multiple fronts moving forward to ensure that we have cast a wider net on this community so we can get a better understanding as to the prevalence of the disease, so we can safely reopen back our island to and its economy. Safely reopen back our island to and its economy.
The pilot project in Estumbo is from 9 a.m. to 12 in the afternoon in the Estumbo housing area. Again, that is Saturday. Once we get more information on the details, we will pass it along. Meanwhile, the governor, along with Guam State Surgeon General Dr. Mike Cruz, break down Guam's increased testing capabilities and a revised trajectory with input from FEMA and Johns Hopkins University. That is expected to be released any day now.
Moving forward.
So
because of that, FEMA recognizes our efforts, and so they readjusted our trajectory to saying that at the peak we would need about 40 bed capacity, and we can meet that now. As far as the 14-day, if we start looking at April, maybe 10th, 11th, where we are seeing mostly 0 positive cases and maybe 1 or 2, we can say that for the 14 days we have sustained that slow spread of infection. And then, of course, testing, and what Dr. Cruz has mentioned about testing, we have about 6 machines on island, together with GRMC's capacity, together with our capacity in public health, and also GMH's capacity. We will have the testing capability. We are also getting more test kits. Linda is being assured by CDC and also the World Health Organization that we would be getting 200 tests for our rapid testing this week, another maybe 200 again this week. and then we will be getting 200 tests every week moving forward. The other one is, of course, the PCR, which we are going to be getting test kits from that would continue doing about 40 a day. The rapid testing one, I think, can do about, hold on, let me just get this information so I'm telling you the most accurate one. Yeah, the rapid ID test, here it is. The ID now, if both machines with the test kits that come in can do about 124 a day, then we have the BD Max, which GRMC already has the BD Max. Then the process of validating it, and also the test kits, and that's about 220 tests a day. So with numbers that are being done and with data that FEMA is looking at, they're saying that if we can have the capacity of 258 tests a day, that's a trigger to start lifting things up. So we will meet those. Also, the Gen Expert, we have that machine. That machine will give you results of about 284 a day. And then one is at public health and one is at GRMC. So with all this, we will, I think, meet the 258 sort of indicator that would trigger us to start lifting. So this is why I'm very urgent about launching this pilot project that we're doing in Stumbo to get us going in a better, effective, efficient way when we do expand it and open it up to more people. Additionally, my advice from Dr. Mike Cruz is that we need to also target more of the people that are also at a higher risk. Like, for example, those that live in multi-generation homes, those that are also our healthcare frontliners. By the way, the tag is going to be also doing testing for her soldiers, and we are also going to include the Guam Fire Department and also GPD in that testing. So we're going to start testing the population of first responders. So to your question, I know it's a long answer to your question, but yes, we do have the capacity. And once we start getting data, Kevin, from these testing sites, I'll be able to be more comfortable and confident, and also with Dr. Mike Cruz and Public Health to see how and also the recovery panel advisors. They get all this information, and we gave them our recovery plan. They're looking at it right now. And so once we get all that approved and finalized, I'm hoping by this Friday that the whole of next week we will be doing more testing so we can have a better picture of the community spread in our island.
Kevin, if I could just add one more thing to the statement. I think we'll probably in the next day or so share the reconfigured models on the projections as far as our bed capacity and the like going forward. With FEMA's models and putting in the full mitigation efforts that the governor has implemented over the last several weeks, it shows there's been a significant decrease in the actual bed gap or the bed delta that needs to be met. And we're pushing a peak and flatten the curve significantly over a longer period of time so that our healthcare resources would not be overwhelmed given the current FEMA modeling that allows for the full mitigation efforts that we've been doing here on Guam.
Yeah. And you know, maybe there's a question out there about, you remember the initial trajectory that we were sending out? Those were done with little history and data. But now that we have actual data for over the last, I would say 5-6 weeks, we can now better adjust our trajectory. And I understand without the mitigation measures in consideration.
The governor is expected to finalize her economic recovery plan this Friday. It still has to be approved by public health. Additionally, Dr. Cruz said the new projection model shows a 60% decrease spread rate, which pushes and flattens the curve. He added that any peak that we may have may actually happen later in the fall, September, October timeframe. An update on PUA and FPUC based upon updated guidance from the U.S. Department of Labor. Those that are self-employed or self-contracted do not need to register as employers on the Guam Department of Labor's virtual one-stop system, HireGuam.com. DOL is actively working on a brand new module for employers to help businesses input employee changes due to COVID-19. When the application process opens for pandemic unemployment assistance and federal pandemic unemployment compensation, there will be a breakout section for employed and self-contracted individuals. They will be treated as employees. As for the latest out of the CNMI, Governor Ralph Torres, in collaboration with Graduate School USA, will host a fiscal response summit starting tomorrow through the 28th with the legislature, business leaders, and members of the public to address the fiscal challenges in the CNMI caused by COVID-19's global pandemic. National media report that the Navy is delaying plans to begin moving sailors back aboard the carrier after crew members have continued to test positive even after isolation. Reportedly, the Navy is temporarily pausing post-quarantine testing and extending sailors' isolation for more than 3 weeks. Earlier this week, Commander of Joint Region Marianas Rear Admiral John Manoni confirmed that several sailors who were in quarantine hotels in Tumon that initially tested negative have since tested positive, but would not provide a specific number. Meanwhile, 8 U.S. sailors remain at Naval Hospital Guam for COVID-19 symptoms, with 1 remaining in ICU. As of today, 94% of the crew have been tested. 678 have now tested positive, 3,904 negative, and 4,069 sailors have been moved ashore. In national news, White House and congressional negotiators have reached a deal on a nearly $500 billion stimulus package to boost small businesses. The last sticking point involved how much money to include for coronavirus testing and how it should be spent. Skylar Henry has more details from the White House.
Democratic leaders say they reached a compromise with the White House on a nearly $500 billion stimulus package.
Staff was up all night writing. There's still a few more I's to dot and T's to cross, but we have a deal, and I believe we'll pass it today.
The bill will likely include $310 billion in additional funds for the Paycheck Protection Program. $125 billion of that will be reserved for rural and minority-led businesses. It also provides $75 billion for hospitals and $25 billion for COVID-19 testing. Minority Leader Chuck Schumer says the final sticking point was the money for testing.
You need a significant federal involvement. You need a national strategy, and the president and Mnuchin and Meadows agreed to that, to their credit, and that will be in the proposal.
The FDA announced it's authorizing a new test that will allow people to do a swab at home and mail it to the lab.
The White House says there are enough tests available right now for governors to start phase 1 of reopening their economies.
If they meet the other criteria of 14 days of reduced cases and sufficient hospital capacity to prepare for any eventuality that may occur.
The president also announced via Twitter last night that in order to protect American jobs, he's suspending immigration to the U.S.
He's going to look at how he can protect Americans both economically and protect their health. And so this is a temporary issue. Just like the prior bans were temporary, and we're doing it to keep the American people safe.
Immigration and travel have already been restricted to control the coronavirus. Skylar Henry, CBS News, the White House.
Guam and Saipan are taking a moment to thank frontliners for everything they are doing to keep our communities safe and healthy during the COVID-19 pandemic. Beginning today through Tuesday, May 5th, first responders and healthcare workers in the United States will be able to receive a free thank you meal day or night via carryout and drive-through at Guam and Saipan McDonald's locations by showing a work badge. Owner and president for McDonald's Guam and Saipan, Joe Ajuju, says, "We hope this small token of gratitude offers a simple, feel-good moment to the police, firefighters, doctors, and nurse heroes at the front line." Now more than ever, McDonald's is led by its purpose to support our communities around the country by reliably providing hot and delicious food.
All right, thank you, Mr. Azuzu. It's 6:36. Let's go to the phones real quick because he doesn't have a lot of time this morning. Let's get Dr. Hoa Wen of the Governor's Physicians Advisory Group. Good morning, Doc.
Good morning, guys.
Good morning. So, you had your meeting yesterday?
Yes, we did.
Okay, so what happened?
Well, we just went over the new testing guidelines that we try to implement. We kind of approach things a little bit different way. Since we have the ability to do more tests, I guess sometime at the end of this month, which is next week, or the beginning of May. So in the past, when we have we don't have the ability to do testing. Everyone else, we just say when you're sick that you can, just stay at home, unless you have severe problems, you come in for us to test. Now that we have the ability to test a little bit more, we will tell aggressive people that if you are feeling ill, that you come in and we can test you. That way we can kind of cast a bigger net to see what the prevalence of the disease out in the community.
So, Doc, just to be clear, people out there who are listening, who are feeling sick, can call their doctor and you guys can give them a test.
Yeah, there's a lot of other test sites. Public health have test sites coming up, and then the private clinic can also do testing. So if you're ill, that you can call your physician. If they have the ability to test there, you can come in for them to do the testing for you.
Doc, I know that in talking about this new, I guess we can call it a relaxed testing criteria, what is that criteria? Are you able to lay it out for us?
It's much more relaxed. If you have any, UI symptom like cough, congestion, diffuse body ache, sore throat, the loss of taste and smell, those you can meet the criteria to be testing already. In the past, those mild symptoms, we don't really want to test it because we don't have the ability to test in the past. But now that the labs and the DOS and public health and GRMC and GMA can do the tests, we can do more tests now. And like I say, we're just like casting a bigger net to try to do the prevalence of the disease in the community now.
Right. I think Dr. Felix Cabrera went over that yesterday. But is there any information you have on how this pilot program is going to launch on Saturday in Estumbo?
Yeah, that's part of the program. But it's targeted to certain criteria of people that, a lot of people don't have the ability to drive to a clinic or reach a clinic for multiple reasons, either because of transportation or any type of means. So Estumbo stood up as a pilot program to try to target those people that cannot leave where they are, to go to the clinic. So let's see how it goes this Saturday. I understand that that's just like I said, a pilot program. So if it's successful, then they can stand up more program after that.
Doc, so the governor had said she wanted to start testing 250 some people a day this week. Is that just going to happen on Saturday, or are we shooting for that goal, today?
We can set a goal of 250, but like I say, depend on if people show up or not. We can have the test kit there, but if only like 10, 20 people show up, then that's all you can do. So. It'll be, I guess, announced publicly. So, like I said, people that don't have the means to or want to be tested now, they can come into the Estumbo and do the testing there.
Mm-hmm. Right.
But we still, the ability to test is there. Again, is pending on the supply. Have to be in place before we can do that number. Right now the supply that we might have shortages, the transfer media. It's just like we call it BPM, is the one that you do the test and you have to transport that kit to the lab to be run.
And this is for anybody who is experiencing mild symptoms or has these COVID symptoms. This is who this pilot test program is for in Estumbo? Yes.
Like I said, in the past, the criteria has very restricted and have to follow, CDC guideline in the past. You have to have fever, shortness of breath, chest pain. You have to be certain meet certain comorbidity like blood pressure, diabetes, and cholesterol, heart disease. Now, does anyone that have any type of upper respiratory infection, like I said, cough, congestion, sore throat, loss of taste and smell, abdominal pain, those are the stuff that we encourage people to come in just because now we need to kind of find out more, what's the rates out there. And it's just like cast a bigger net.
Right. I just wanted to make sure it was clear who was supposed to go to. Are they going door to door, or are they setting up a location for people to come to?
Well, I understand it's a location, so it's not door to door. It require a whole lot of manpower to do door to door.
Yeah.
So we just there's one location and they just come. However, the criteria relax a whole lot. Like I said, the message in the past, if you're sick, stay home.
Right.
And the reason you do that because you don't have that much test kit. Now that everyone stand up, we have much more ability to find out the true rate of infection. We can encourage them to come out. So that way, if I tell you that you have it, we can really isolate and track and trace the people to try to prevent them from spreading the infection in the community.
Where is this going to be at?
The other location is not announced yet last night. I know it's in a similar area, but I don't know the location. Public health still try to talk to the mayor to try to finalize the location for this weekend.
Mm-hmm.
Doc, we're just getting some comments here. What if you don't have a private doctor or insurance? What about those people?
Oh, those tests, guys, are totally free. Absolutely, any testing for COVID-19 shouldn't, you shouldn't pay anything at all. It's free. You don't charge anyone for the test. Just including people that go to the tier 2 location right now. It didn't cost you anything to go there.
Okay, I think that's how we market it. People in Guam, they love free stuff, so we should just do a big campaign. Free COVID-19 testing. Show up.
Yeah, I don't think that any COVID-19 testing should be charged. This is an infection that we try to control in Guam and everywhere else in the world, so no one should charge to do the test at all.
Is this kind of like the study you were talking about last week?
No, that's different. That's
okay.
The studies for public health and UOG are part of it, and some physician that's part of the serology testing backed up by the PCR test. That's different. This is the PCR testing that the confirmatory test. So this is different. Yeah, just because, like I say, we have 4 different places now that can run the test, so might as well just use them all.
Right. Okay.
Doc, how many test kits do we have? Because you said that we now have the capacity, and before we were limiting the priority, the testing to the limited priority group. So now that we're widening this criteria, what do we have in the inventory that's ready to go?
That's the question. Like I say, when we have the machine, I think the most important and the limiting factor right now is the transport media. That's the only one. Are you
talking about the cooler or something, Doc? That with the dry ice?
No.
What is it? What are you talking about?
We call it VPM. What I can tell you in straight language is that when you do the nasal pharyngeal swab of your nose there, you have to put the swab inside this tube to have the liquid in there.
I see.
And that is the tube that transport to the lab for the lab to run your test. And right now, that's the limiting factor, not the machine anymore, because we have enough here in Guam. Actually, we are pretty good shape regarding machine-wise and the ability to do tests compared to the rest of the U.S.
Right.
Pending that we have enough VPM to go around for everyone to do testing.
Well, how limiting is that going to be? Because we're anticipating rolling out and possibly testing hundreds, if not I'm guessing our goal is we're going to try and test 250 people a day. 258 people a day. So if we don't have the VPNs, how many of those do we have, Doc? Do you know?
I don't know the number, those tests with me is available through DOS and public health. So that's where, you initially you might have enough, but then if you do that much, you might run out. Just because, like I say, it's not just Guam,
Right.
it's the rest everywhere else that's a limited factor.
Mm-hmm. So we have the machines, 2 at GRMC, 1 at GMH, and 2 at Public Health? For a total of...
Yes.
Okay. Do you know how many test kits we have? I know they're different kinds, the Gene Expert test kits. Did those ever come in?
I understand that they come in already, and...
this is the 4,000?
Yeah, they're going to be all ready. You're talking about the rapid test kit. That doesn't count.
Okay.
This is, that's a wholesaler in the public, but that's a different type. I'm talking about just to run out of the public health, DLS and GRMC and GMH only. That's the only one we're talking about.
Right.
Okay. So,
but these do have the ability to do same day results. I mean, it may take a couple hours, like how we're getting them currently, right?
Oh yeah, it's the same day result. Especially the Abbott test kit, and those things, you can have the positive in about 3-4 minutes.
Mm-hmm. Wow. This is the Abbott ID now?
Yes, we have 2 of them. So
this is the one that's at GMH and then GRMC?
Yes, and those things are very fast. Negative result in about 10 minutes, and positive about 2 to 4 minutes. You have the result already.
What about that BD? Is it BD Max?
Yeah, the BD Max, and those take longer. It's not as fast as the Abbott test kit.
Okay. And that's the one that GRMC has.
Yes. No, I think GRMC have the Gene Expert. I think that's the recent model. Yeah, those take longer to run. But I think hopefully if we can have more of the Abbott rapid test kit, and those things are really nice device.
Doc, so do all of the Abbott ID and do they all require the use of the VPN that you stick the sample in?
Yes, they all require the use of VPN.
So we could have 1 million test kits, but if we don't have enough VPNs to put the test swabs in, then it's kind of a moot issue, or are there ways to work around that?
I think right now they try to come up with ways to use different type of nasopharyngeal swab that don't have to use that VPN. But I think right now that's all we have, and that's all the rest of the U.S. have. So, like I say, that's a question that we have to be very good at managing the inventory, make sure we have enough of those things to run.
Doc, can I, on the testing, because I wanted to just kind of find out just more on the testing for the COVID-19 side. Because we're getting a lot of negatives. Is there any science, or what can you tell us about when you test somebody for COVID-19 and how long they've been infected, and how that relates to the amount of the virus that they have in them that would trigger a reading on a test kit? Because I was just reading last night that depending on how long someone has been infected, there might not be enough of the virus in there to get something to swab. Can you just you maybe go into the weeds on that and explain that to us?
That's the question: is when can you test, and if you test negative, is that that you don't have the virus? And that's a $1 million question. Is the viral load sometime at the front end of it, you don't have enough viral load to turn positive, but doesn't mean that the next week when you test again that you won't turn positive. So the question is, when do we do enough tests to kind of pick up the true positive? I tell you, because no one has the right answer for that one. It's going to be a combination of serology test and the PCR molecular test, but it has to be a combination. Right now, the question is where the ratio and the mix of those two to truly identify the person that is positive. There's not really a good FDA approved serology test yet right now. So I think that even in the States, they still try to juggle that ratio in order to give you a better number, the true number. So let's say that you come in today and you have congestion, cough, and you just get sick like a day or two. They might not have enough viral load in all the people that turn positive. So, and that's it's not 100%, like I say, depend on the viral load. So some people might have it, and some people might not have it. So that's the.
What's
that's
like
the?
I mean, is there like a percentage, Doc, like an accuracy rate with these tests that we're using? Just because it kind of seems like what you're saying is if I've got loss of taste or sense of smell or whatever, I go in, I get tested, I'm negative. They kind of seems like you're saying that might not even mean that I'm really negative.
Yeah, I think the specificity and sensitivity of those tests is very, very high. So that didn't mean that they're talking negative thing about them. They're very high. It's just that if you don't have the viral load when you come in, then you might have negative. But like I said, I mean, those numbers are very, very small. But we just want to be aware that, hey, if you have a symptom, we tell you negative, but just have to kind of watch yourself and isolate yourself against your family or the people, so you don't spread the virus to other people. Like I said the key here is to identify them, bring them out so we know the true rate out there, and tell them, hey, you stay home. By this time, and you can track and trace all the contact. Unlike before, that if you have the virus and you have mild symptoms, especially young, I tell you stay home, and you might not stay home. But if you know you have it, the most likely chance that you will stay home and comply. That's the thing. So you don't spread out the people around your house and your neighbor or the community if you go somewhere.
Doc, we got a comment here, and I know this is something the governor touched on. It was people don't want to get tested because they don't want to get thrown into quarantine.
The testing, the quarantine is a voluntary quarantine. We tell people, we encourage them if they're positive that to stay home and isolate against the family. It's not like you got thrown into a hotel and it's a involuntary quarantine. It's not. So it's not a concern. You just want to know if you have or not, but no one is going to lock you in one place to quarantine you.
But if public health goes to your house and they make a determination that your house is not able to sustain a CDC recommended self-isolation because there's doesn't have its own bathroom or whatever, and then the governor had said that at that point they would stick you in a facility.
Yeah, that's an elective thing. And Chris and Sabrina, the things like this. If you know that you're positive, and if you live in a household good that have very young children, or you have an elderly or someone living in your household good that have a high risk of have complications from the infection, of course, they're going to talk to you and they're going to explain to you, educate you. So that's the reason why we recommend that you stay in a hotel or quarantine during the isolation, along with one person in your family, so that way that you can you don't transfer that infection to a person that have a high risk of have complications from this. You don't want your parents or your grandmother, your grandfather to have complications, end up in the hospital. So that's the key. So, and they're not going to take you in a police car. They're going to explain that to you. So at least you have an option and you have more educated decision that, hey, this is for the best of my family. It's not that the governor tried to force you to do something. It should try to protect you away from your family, that you can give to someone, your loved one, and make them sick. So that's a protection the governor want to give to you. It's not to force you.
Mm-hmm. I just wanted some more clarification about what's going to happen on Saturday. When people come in and they get swabbed, are they going to find out the results there, or they're going to have to wait until? Where are these samples going to be taken?
That's I'm not quite sure on that one, but I'm pretty sure you find out either the same day, the next day. That's the goal, is to give you an answer very, very quick, so that way, the public health team can go out there and contact you and do the tracing and all that kind of stuff. So, yeah, the thing here is get that turnaround time really quick, so that way they can, they can do their job.
These Abbott IDs, are they mobile? Are you able to take them to Estumbo, or they have to stay in the lab?
Yeah, that looks like it's pretty mobile. It's a pretty
small
device.
Yeah,
they're not,
so you don't know if that's the plan, to bring the Abbott ID now to Estumbo?
I asked a question last night, but but the key here is to get that resort out as soon as possible. So they're not going to, sit there and prioritize and run, whichever high priority for. They're going to run. They're going to for them to run this test. So I'm pretty sure it's the same day, the next day they find out already. So that's the wonderful part, is the ability to complete the test and let you know right away.
Yeah, I just wasn't sure how this was, the specifics of how this was all going to go down, because if you're saying that the Abbott ID can give you results within 2 minutes, and they're also deployable, then you could ideally just bring the Abbott ID to wherever this place is in Estumbo and then give people their results.
Yeah,
and you can keep a running tally.
And that's something that I think that discussion to see if we can request more of those Abbott ID tests, the device here. Cause that's really wonderful. That's it's so fast. It's amazing.
Yeah.
Wow. Well, Doc, when we do this testing on Saturday, do you think we're going to get 0 positives?
Everyone hopes. That's the thing. So far, the last 7 days or so is very good. Like I say, and this weekend is the probably a highlight, because the Easter weekend. It's 5 to 14 days there, so we see this weekend hold true on all the 0 testing or not.
Do you know what the sample size is?
Like I say, depend on how many people show up, guys. I mean, we can put the location and the availability out there. It depends on how many people show up for the testing, and so that's why it's going to be in one area where people have limitation on access to a clinic. So that way we can see. It's like I say, it's a pilot program to see if we can put test location, a pocket throughout Guam, but it's easier for people to access the test.
Yeah, I was just curious, because I'm just wondering what contingencies are in place if the sample size is, say, 200, and you have 100 or so that test positive, and the people that are coming out that take these tests don't have, I guess, the CDC requirements for home isolation.
Right, they're not going to, because we're talking about vulnerable population of people living in poverty, like a lot of people.
Because you have to have the separate bathroom in the room. You know what I mean?
I think that they have secured different hotels throughout Guam for
isolation.
For isolation, if the people wish to leave their house and go and stay there for isolation. So, like I said, those are public health when they come out to a positive finding and they talk to the family. It's part of them to educate the people and the family on what their option is, and let the family choose the option. Like I said, it's not a forced quarantine. They're gonna explore everything with the family to make sure the family understand, what's the idea of isolation and how to go about to do that. In light of how the house is. The household good in Guam is pretty unique. Sometimes you have multi-generation that have like 2 or 3 4 generations in one house.
Yeah.
And and you have one person that is positive, and you have some family member that is a high risk. of course they're going to try to educate you and let you pick the best option to protect your family.
Mm-hmm.
And that's the key. Is for the family, protection is not, they're not going to force you.
Mm-hmm. So if you have a one bedroom home and someone tests positive in that household, you can make the decision. Well, I'm just going to stay here, and you're not going to put them into isolation. Into an isolation facility.
That's not the most logical decision, but if that's the case, they're going to test everybody in the family very careful, make sure that it doesn't transmit to other family member within the household. Good.
Okay.
Yeah.
Okay.
Yeah. I mean, good luck with that.
Yeah, that's a tough one.
I don't know. I think if we got to protect the public and put these people in an isolation facility because they're living in a house that, and that's going to be so many people, Doc. It's a good question, Bree. So I don't know. I think that we got to do what we got to do to protect the public.
Yeah. Sometimes, we live in a free country, and it's
sometimes
you can't force people to do things. Even the roadblock is a very good idea, but a lot of people doesn't like it, and I understand that some people sue the governor, which I have no idea why. But it's a free country, and it's hard to implement that. I think the part of it, some place like Vietnam, or a place that control it very well, because you don't have a choice.
Right. Yeah. Doc,
and I don't even think that was coming from a bad place. But, whatever.
Yeah. I mean, it's a reality. We had someone here comment, does the government foot the bill if you have to go and stay in an isolation facility?
Absolutely. It doesn't cost the person any.
Okay.
The government will foot the bill to put you in a place of isolation in order for you to be safe against your family.
Yeah.
So no, it didn't cost the public anything. It's just government federal footing the bill. It didn't cost anyone anything to stay at the hotel.
So Doc, Bree, anything else?
No, no.
In closing, the message has been: if you're sick, stay home. Stay home. Stay home. So now we're changing the message. Am I correct to say that the message is now, if you are sick, call your doctor, go get tested. Everybody get tested. Everybody get tested.
Right, so that they can see just how prevalent COVID-19.
Right. And don't wait till Saturday at Estumbo. If you're sick, you have any mild symptoms that, Doc again told us about, call the physician, go get tested. It's free.
Mm-hmm.
It's free. It's free.
It's totally free. And also, another message that we like to put out to Chris is that the chronic care management, we're going to encourage the people that have chronic illness like high blood pressure, diabetes, and cholesterol and heart disease, and that they need to still contact the physician in order to continue the care for that. The thing that GRMC was mentioned is that they see a new wave of non-COVID patients hit the emergency room because of complications of those chronic illness, that they run out of medication or they're too scared to go to their doctor's clinic to continue their care. So that's something we want to pass out to a lot own the clinic now to take extra precaution to protect the wellness of the patient, so you won't sit around other people that have illness. So we put the message for the chronic care management for people that have those chronic illness to please call your doctor and make the effort to come in and see them. So that way we prevent the non-COVID complication that hit the emergency room and admission beside a COVID patient.
I did have a question. I know Dr. Lewis Cruz is in charge of like the alternate care facilities and things like that. But is there an update on any of that? What's going on with Surgery Center, the Finnegodson facilities that are being constructed, and then you have the Naval Hospital, tent city type hospital that's being constructed?
Those are planned for the worst scenario, guys, and is still continue on the planning stage, and some of them are in place. Yeah, just like anywhere else, I heard the news like yesterday in Florida, there's a lot of the stand-up hospital that sit empty right now, which is no, I know it costs a lot, but like I say, everyone plans for the worst and pray for the best, right? So, yeah, those efforts still continue.
Okay, yeah, because it just again going back to Estumbo, if you do a large sample size and then you do have a high number of positives, hopefully not, where would you put everybody?
Yeah, you have a lot of places, including Guam Center, and you pass by Nicktam, you see lots of pallets there. There's a whole little portable hospital stand up there to support the Navy, and once the Navy case is over, those remain open for us to use in case of.
When is that going to be, Doc? Because I mean, geez, they're looking at what, almost 700
I think
positive cases.
Manoni said that it's almost
yeah,
finished.
I mean, you pass by Nicktam and you go to their hospital, those things are up already. So they are there. Like I say, they're not going to put them away once the Navy move out of here. They still going to remain open in case of Guam needed. So they here to support us.
Yeah.
Doc, again, the comment here: no insurance, no problem.
No insurance,
for testing.
No problem.
Right.
Yes, it's free.
I got it. You guys need to loop us in, and we'll help market this thing, and we get a crowd out. That's kind of what we do.
That's what you want, right?
Yeah.
That's why I want. That's why I'm on the radio with you for, is to help us, put out this public notice so people know that it doesn't cost anything.
Okay.
That's all you got to say. It's free. People are like, what? What's free? Okay, I'm here. Serious, Doc. I'm serious.
Okay, but thank you so much for passing out the message.
Of course, Dr. Hoa, thank you for giving us the message to pass out.
You're welcome.
Okay. Did you drink your coffee already, Doc? You okay?
Nah, it's okay. You waking up this morning. Just kidding. I'm up already.
Okay, Doc. Thank you so much, and wash your hands, okay?
Okay. Thank you, guys.
Okay, there you go.
Okay, bye.
Bye-bye.
There you go. So we have a new message for you guys. We are deputizing each and every one of you watching out here. The new message is, get tested.
That's right.
Get tested. Get tested. No insurance, no problem. It's totally free. All right, so if you have any anxiety, who doesn't? Who doesn't want to get tested?
Yeah.
You know what I mean? Is it uncomfortable? Yeah, they stick that swab up in your nose. It's a little uncomfortable. You're going to tear up. But, we got this. We have the power to kill the curve. And, from what everyone's saying, the best way to kill the curve is to get tested.
And this Saturday, there's going to be the pilot program testing at somewhere in Estumbo from 9 a.m. to 12 p.m. Hopefully we can get that information from today's press conference.
We will.
Right, and what they're trying to do is they're trying to cast this wide net to determine the prevalence of COVID-19 on Guam.
Right, and so the governor went out and made that commitment to the people that they're going to test 258 people a day starting this week. And so I think that's going to be.
We don't know the sample size, but you could.
But you guys can help. I mean, if we have the capacity to test 250 some people a day, then go get tested, guys. Go get tested. Let's use up those test kits, or else it's just sitting there. 7:10 now. We're taking a little break. It's the 22nd of April. The KUAM News takeover of Guam's favorite I-94. It's containing COVID. Good morning.
KUAM News Updates are brought to you by McDonald's of Guam. I'm loving it.
Howdy, this is Ryan Flowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD. healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Top of day, everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important.
The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please, stay home! Saga Gigimatmizu.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
We're working hard to keep you safe. Wash your hands. Stay home.
Be healthy. Be informed with ITD.
Good day, everybody. I'm Sabrina Salsmatanani.
And I'm Chris Barnett. Join us bright and early weekday mornings on I-94 for KUAM News' Containing COVID morning radio show. It's also being broadcast live on our KUAM News Facebook page.
You know, we don't want to be doing this forever, and you probably don't even want to listen to us forever. But that's why it's so important that you practice social
distancing, you know the drill, wash your hands.
And stay home! Just stay home!
Stay home!
Be healthy. Be informed with ITD.
It's the KUAM News Takeover containing COVID. Good morning to our Facebook Live viewers. Hey, remember, 8 o'clock, we jump over to KUAM TV 11, 720 on the way from the Guam Fire Department. Chief Dan Stone to talk about the new COVID transport that they rolled out at 7:19. And we also have a soundbite here from yesterday's press conference, the Adelup press conference. With Linda DeNorsi of Public Health. She was asked a question by our Adriana Cotero, right, Bree?
Right. It was related to the testing in Estumbo, and she wanted to get more specific details.
And so we're going to play this, and then we're going to come back and kind of unpack for you all the stuff that we heard from Dr. Hoa from the Governor's Physicians Advisory Group.
I have a question for Linda on the community testing. Can you provide further details on the pilot project beginning this Saturday? I have a question for Linda on the community testing. Can you provide further details on the pilot project beginning this Saturday in Estumbo? A rundown of how it will operate, and then when expanding, how will the pockets of village areas be determined? Will village mayors be part of this process to identify high-risk populations? As they just found out last week, Friday, how many COVID positives are even in the village. And then how will people be receiving info on the community COVID testing altogether?
Yes, right now, as I speak, we had a planning committee that we mobilized, which includes public health and, of course, the other, the mayor's council. Our representative was Mayor Savares. And we looked at all the details in terms of how the swaps are going to be done, and are we going to have the perimeters, making certain that it is well secured, making sure that we also have an ambulance there should anybody have any emergencies at that time. We're looking at a drive-through towards that perimeter that we are identifying, and looking at just like you said, a pilot study. We're looking at a small sample size to start off with. And what we're trying to do is we're trying to involve not only the department, but also other agencies that will be involved in this project, as you know. Of course, working with the Physicians Advisory Council and all this, so that we're all in line in terms of identifying and moving towards, of course, these pocket areas that you're identifying. We are working with the mayor's council, and we're looking at representatives of all this area. But I'm just going to elaborate for now on the pilot project that you're asking. And again, we're launching it so that it will meet our sample size. As you know, Dedido is a highly populated area. It also has high risks involved in the patients that are there. And we're looking at mild illnesses, patients that come in. We're doing case findings. That's what we're really focusing on. As you know, we're continuing our efforts with identifying the clinics to expand, and that will continue, whether they are seen at the private clinics, at the public clinics, or even at the hospitals, both GMH and GRMC. In this particular case, it's case findings, and that's what we're elaborating on, so that we can identify these mild cases, and they will eventually present themselves. We will notify the targeted group, and that will be done so that they know what form they're going to fill up, and be prepared in having that form completed, and they will be notified through a flyer that will be distributed to them. And we're getting the mayors to be involved in that process. And so that, in a nutshell, is the activity. And of course, working with other other government of Guam agencies and the TAC, the National Guard, to maintain the perimeters, ensuring security and so forth. And so that's where we're at. And as the governor had indicated, that's what we're gonna do, as she had indicated.
So just following up on, Governor,
I just wanted to ask if Dr. Cruz can chime in and how we're gonna work together
Right.
cohesively so that we move forward and end up being in line, and again, going to identify other individuals.
So this pilot study is going to proceed, but it's going to be a part of a larger overall community testing protocol that's going to be marched out. We have, again, as Linda stated, a planning session this afternoon with the Physician Advisory Council Committee, along with public health officials. And so she's going to identify this one pilot study, but we also want to make sure that the vulnerable populations, those are the, as the governor stated, multi-generational, multi-family homes, end-stage renal patients, those with significant comorbidities, frequent flyers to the hospital that we know that are coming back and forth to different hospitals, to either GRMC or GMH. These are vulnerable populations that if we don't identify, make sure that there's not a cluster or a positive within those particular communities, they will in fact be the ones that are going to overwhelm our healthcare system, especially the intensive care unit. So again, as we do this, there's going to be multiple fronts moving forward to ensure that we have cast a wider net on this community so we can get a better understanding.
Cruz and Public Health Director Linda DeNorsi talking about how they plan to march forward with community testing. And the first stop will be in Estumbo Dededo this Saturday from 9 a.m. to 12 p.m. What they're trying to do is they're doing this mass testing in the communities to just study and take a look at how widespread COVID-19 is on Guam.
Right, and then one of the other areas that they mentioned a bunch of different areas where they want to do this community testing, but one of the areas that they did put out was the Sagambasita and Agate. And so we want to bring Agate Mayor Kevin Siswico onto the show. Good morning, Mayor.
Hi, good morning. Good morning, Chris. Good morning, Sabrina.
Good morning.
I guess just first of all, tell us what you know. I know that the governor and her team had put out that we're going to do testing at Sagambasita. I guess my first question is, what are the residents saying? Have you been getting calls about this?
You know, we have been receiving a few calls, and you know, the information that we received into our office was very, very minimal, and it was more of an inquiry question regarding, of course, the use of the facility. But they're requesting to utilize the Agate Senior Citizen Center. I know it's a little bit closer into the village, but according to them, it's supposed to be you know, kind of like a drive-up, if you will, right? A drive-up type of testing where the doctors, nurses will come out and do the testing right at the vehicle, and then the vehicle kind of pulls away and heads back out. But nothing has really been confirmed with our office. I know, again, it was just an inquiry regarding this side, of course, of our area, because Inarahan is already testing down on that southern side, so they're looking for a testing area for our side. You know, I know that we have some constituents that have some concerns about, oh, you know, Mayor, what if people are tested and what if they are positive? And you know, this could bring the virus to our side. But you know, it could also mean that we could actually find out if there's anybody in our area that could possibly have it, that may not want to be tested, right? So I guess it's a two-edged sword, if you will. And so you know, at the same time, we don't want to bring anything in here. I mean, we've already had 3, and thankfully 2 have recovered. But you know, at the same time, we want to see if there's anybody else out here that you know would be willing to get tested. And of course, if they do, then you know, we would like to at least provide the facility. The second visita in which they were requesting for would be kind of hard, especially since it's going to be a drive-up or a drive-in type of testing, because then, you know, it's a fenced-in area. So I don't know how they're thinking they're just drive in and then be able to turn around in the inside without causing a traffic jam within the office.
Did they?
And another thing is that, you know, we don't really want it to be down at the second visita because, you know, our office is still open every day, and we don't want people to say, okay, you know, maybe this line's long, let's see if we can just walk into the mayor's office to try and see if we can get information. And you know, we put our staff at on the line there too once they get out of their vehicles. So.
Right. So Mayor, when you heard them throw out Sagambasita, were you surprised? Were you consulted at all in this?
I was consulted by Mayor Melissa Savares from Dededo, but again, this is based on just inquiry, and it seems like every time they're going to have something down here in this area, they always utilize the center, so it's nothing new for us. Again, we're always willing to help, but give us the information so that way when the public comes to our office or when they call in, we know what to tell them too. And that's been my biggest one of my biggest concerns since the very beginning is that give us the information we need so that we can answer our people. I mean, we get these calls every single day, and so when it hit the news, everyone was saying, Lanyat, Mayor, this is going to be a problem here. And, have you ever considered this? I mean, did we consult anybody? And so it's been quite a challenge in our office for the past few days since the Sagambasitas haven't come out. And so again, we're willing to help, but please ensure our community too that the testing will be done correct, and at the very, very minimal there will be little to no exposure or any type of possibilities to where that could actually lead into our community. And so when they said drive up, that could be a possibility, because the Senior Citizen Center has a large parking lot, and then they would just kind of flow out without getting down and contaminating the building or touching anything in the inside. And so,
did they request for mayor staff to help with these clinics?
No, they didn't.
Okay,
and for that, I probably would not even allow my staff to get near that because we're not trained.
Right.
And again, we know nothing about this. And besides, use your mask and wash your hands and practice clean hygiene. But other than that, we're no one to be put on the line there.
I thought that was interesting, Mayor, when the governor had come out and said, "Hey, we're going to ask the mayors, where the areas are in their village where they think there might be a
And that's another concern is that we don't know, and we don't know where in the area, and public health, even on the last 3, wouldn't release any other information other than, well, there are 3 in your community, and that's all the information because of HIPAA, and I understand. But at the same time, I mean, give us some information for us to at least be comfortable enough to make these type of decisions, because when we make these decisions, we have our population is right behind us, either one gonna get ready to choke us, or 2 be ready to support us. So I mean, we need to be ready, and most especially armed, at least in our office, with the right knowledge to again explain to our community what exactly is going to be happening. And so I'm still waiting for a call from public health. The only call I received was just from the Mayor's Council of Guam's president, Mayor Melissa, just requesting again to see if the possibilities of using the Sagambasita at first or the Senior Citizen Center would be available. And so again, I'm sure the officials are listening to the call, and I'm pleading with you to please, if you want us to help you, help us, because there's no way that we can do this alone, and there's no way that they can do it alone too. And so
you sound a little frustrated.
Yeah, it's like you guys are always the last to know, Mayor.
We are, and the frustration is there because again, the frustration is there because we get the information last. We truly do. And we're here every single day with our community since day one. They said, don't close, you're essential. And, we're just trying to reassure our people. We're out there delivering our senior citizens lunches. We're out there trying to keep the village maintained. We're out there delivering lunches for the students. And so we're doing our part. But as far as the testings and as far as, keeping everybody safe, they need to give us, and they need to arm us again with that knowledge of that information so we can do our jobs and we can actually be out there with our folks, with our communities, because that's the only way it's going to work for the mayors.
Did Mayor Savares give you any indication on when they might do this drive-through testing in Agate?
There's no confirmed date for Agate because I believe they're starting up in Dededo and the more northern and central areas first. But again, people may not be able to feel the symptoms then. I mean, you cannot say, okay, we're going to be doing the testing this Friday, so everybody plan on being sick this Friday. I mean, you know what I mean? So it's kind of hard for them to say, Agate, you're going to be scheduled for this date, because you don't know if they already had the symptoms before, they just didn't want to get tested, or they're going to feel it the day after they're done with the testing. So I really don't know how this is going to work, and I'm quite interested to see how it's going to plan out in Dededo. I know we don't even have the right numbers of test kits. There's...
What can you tell us about that, Mayor? I saw that you messaged me that. So what are you saying? What are they telling you about the number of test kits that we have and the ability to perform this community testing at a level that the governor said we would?
Well, I'm only, again, I'm going by, I watch the news all the time, and I'm just going based on what I see on the news, just like everybody else.
Right.
Because that's the information we're getting,
right,
which is already secondhand. And so, the governor is saying that she doesn't want to utilize any other test kits other than what's been tested already by CDC. And so, the test kits aren't here from what we're told, right? And so if you only have 2,000 test kits, for example, and Dededo has 1,010,000 people up there. I don't see how that.
I think it's 1,012,000, Mayor. We got to be accurate.
Down here in Agate, right? So, we'll see. I mean, we'll again play it by ear, because we don't have the date. That's how the call came into the office. It was just an inquiry. There's no date for Agate. There's no. They didn't give us any other information other than, would you be willing to host the testing site down in the municipality? And so, again, of course, we're willing to help, but give us the right information that we'll be needing, so that way we can keep our public, aware, most especially those that are concerned, because we do have our share of those that are under dialysis, or those that may be under receiving some other medical, services, and we really need to know that, because those are the calls that we're receiving already.
Right.
And again, we just like public health has been reassuring everybody else, is that just stay indoors, stay at home, and keep washing your hands, and keep your hands out of your face, because that's the only way that it could be transmitted. So everyone is saying, well, Mayor, if they drive into Agate, then we're going to immediately get the virus, and it's not that. That's not the case, right? So
when's the last time you guys have had any communication with public health?
I received that call from Melissa, I believe, on Monday.
Oh, no, not from Melissa, but from public health, just a briefing on what's happening or anything like that.
We had a Zoom meeting, I think, last week, if I'm not mistaken. I want to say last week.
This was for the dashboard?
That was the dashboard meeting. Yeah. So no other meeting has been set after.
I feel your frustration, Mayor, because you're right, and we deal with it too here in the media when the governor's office and the COVID-19 people go out and say things. Dr. Cabrera said it yesterday. It was there's a difference between discussion and decision. But when they go out and they say, "Hey, we're going to do a Stumbo. Hey, we're going to do Agate." I mean, it just, people need to know. They want to know, and they want to know yesterday. And so, like us, you're right there on the front line getting the calls.
The influx of calls, I tell you, the moment that Agate's name came out there in the second Mesita, the calls were flooding our office, and I put it on our mayor's chat saying, "Hey, give me more information on this, because we cannot just go based on an inquiry to our office and then have left us out there. You're leaving us out there to fend for ourselves as far as information." And people are saying, "You guys are going to have this thing down here. You don't know when you're having it. You don't know how many test kits. I mean, why would you guys even announce this to, for the public to know?" And hey, we're at the same mercy of everyone else,
which isn't right. I mean,
asking for the information.
Yeah,
give us information.
Right. I mean, you're an elected leader. You need to be a little bit, not above the people, but you should be getting the info, real time when they make these decisions. You guys should be included in it, so you're not blindsided. But you're not the only one. I hear too that
we work directly with our people, and right. I don't see why it's always hard for us to get the information. But again, it's no different from even a typhoon, So everybody's updated, and then let's call in the mayors, right?
Right.
But when things hit, let's check the mayors and see what they're doing.
Or how about when it's election? Oh, let's check the mayors.
So I mean, we always get that. It's the same thing. I just really wish that we had an open communication where we were updated, at least on a weekly basis, and not just, we'll send you a message if something comes up, or if your village has a cluster, or if your village has a hot spot, or let us know, please, because, we're doing our best down here to try and keep everybody safe. We're trying to keep everybody indoors. We're trying to keep everybody just, everybody's anxious to get back to their regular daily lives, right, and their daily schedules.
Right.
Have you talked to Mayor Savaras since the last time?
I did. I spoke with her yesterday, and I spoke with her because I put a call to her saying, Mayor, give me whatever information you need, because I'm expected to receive a call in the morning, and I want to make sure that when I receive the call from Chris and Sabrina, that the information I'm giving is the information you're giving, because that's the only transparency I have is between you and me. That's mayor to mayor. I don't have any other information other than that, because I haven't been the one in contact with public health.
Yeah. So is this how it's going, that Mayor Savaras is the point person for all the other mayors?
She is the point person because I believe she's the one that's kind of leading the way, leading the way for all the other mayors. And so the Zoom meetings are arranged by mayor, and if we do have a meeting or if there's any other information that they need, she contacts us directly, and we try and assist her. And I understand that for Linda, she can't reach out to every single mayor or every single person that has an inquiry. But again, when you're going to utilize a community, this is a community that you're going to be utilizing.
Yeah, Mayor, that's why we have 5 spokespeople there at Adelup. That's so that they can go and Tentagu and go and work with the mayors. You know what I mean?
Yeah.
I feel you, Mayor.
I wish that was the case, but again, for me and to our people, again, let's stay indoors, let's stay safe, and we'll try my best to keep everyone posted with the information that I do have. But as far as the information that we do have, it's very minimal again, and I hope that to the people of the administration, please give us information as the mayor, so that way we can actually help our community and our constituents.
Thank you, Mayor.
Okay. Well,
Thank you so much. You guys have a nice day.
Mayor.
Okay, if you need anything, just let us know. Agate holds a special place in my heart.
Well, me too. Hello.
I'm saddened because this year we had to cancel our Mango Festival, and that was one of the biggest things that it was with a heavy heart that we had to put out the cancellation.
And Mayor, when people talk about being impacted, I mean, I'm so blessed. I'm really just so fortunate to have this job and to be able to come to work, and man, I host social gatherings. That's like how I make, my side income. Yeah. So, when you guys cancel the Mango Fest, but I have to ask before I let you go, where the mango at? I mean, can we, can you arrange a curbside drop off? Bree, I'm serious.
No, I am too.
Yeah, I mean, I love the mango, Mayor, and I'm just saying, everybody.
And this year we like you're saying, we were blessed. This year we didn't receive a lot of rainfall, and we didn't receive a lot of hard winds, and so the trees are just blooming.
But to that, no, yep.
Oh,
yeah.
Man.
Okay.
But
so
anytime we'll arrange for that.
I will. I can do a drive-through.
We'll do a 6 feet social distancing.
Right. Yes.
I'll put it on the galley and I'll pass it up.
Thank you, Mayor. All right.
Okay.
So wash your hands. There you go. There you go. Agate Mayor Kevin Siswico. Of course, the frustration we've heard ever since the beginning. The mayor's just not, and it's sad. It's almost like this situation with former Governor Gutierrez. Is you have all these people with this experience who have know-how, and these mayors, like Mayor Siswico said, they're right there with the people.
Yeah.
Okay. 742.
Wait, before, big shout out to my family down in Agate.
Right. You got to say it like Agate. You can't just say it Agate.
Oh. Okay.
Say it like that.
No,
all
it's
right.
fine, Agate.
There goes our mango.
No.
So there was a release that came out from the Guam Fire Department, part of the Joint Information Center release. Can we just kind of get that, and then we'll get Chief Stone on, or you want to just bring him on?
Oh, okay. So they established this COVID transport unit. It's in Jotnia, and I believe in Estumbo.
Right. And so let's get from the Guam Fire Department. He's the chief, Chief Dan Stone. Good morning, Chief.
Hi, Chief.
Hey, good morning, Chris and Serena. How are you this morning?
We're doing pretty good. I guess, what can you tell us about, we'll just go back to when you came up with this idea for this COVID transport. Maybe if you could walk us from that point to its implementation.
Sure. So the whole premise behind establishing the COVID transports was in an effort to, a couple of fronts. One, obviously, excuse me, at the early onset of this COVID-19 response, we were burning through a lot of our PPEs, our personal protective equipment, from our masks to gowns to gloves and things of that nature. And we were recognizing that early on. And although we were still maintaining an adequate supply of PPEs, we, as contingency planners in the Guam Fire Department and all first responders, is looking at, weeks ahead. And so as we were having this discussion, we recognized that if we were to come to a point where PPEs were going to be more and more of a challenge, how can we help to slow that or mitigate that? And establishing the COVID transport was one of those ideas that were brought up. So basically what this does is it allows us to utilize these particular vehicles for the purpose of picking up seemingly stable PUI patients. Instead of potentially infecting or utilizing the rest of our emergency response fleet to go out to these PUI patients, what will happen is when we get the call through the 911 center, our 911 dispatcher has been doing a phenomenal job of gathering that information, that really pertinent information, so that we can, so they can help us make a decision as we go to the response as to whether or not these patients could be potential PUIs. What that also does help us is when we send a responding unit, or whether it be an ambulance or a fire truck out, we conduct what we call a doorway assessment now. So instead of going straight into a patient, we do that 6-foot patient survey. And when they're gathering that information, if this person seems like they're relatively stable, they may be showing symptoms or displaying symptoms, but they are stable, we would activate this COVID transport unit.
Is there a number? Would they just call the regular 911 or?
That's correct, Chris. So it would be a simple 911 call to 911. And
hey, people were asking in the comments, Chief. Sorry, I know that sounded like a dumb question, but there's no 912 or. Sorry.
That's where it all starts. It starts at that call center because, like I said, our dispatchers. I tell you what, they've been doing some tremendous work up at the call center. They're asking all the right questions and being able to relay that information to the responders in the field. And as our responders go out and they get their eyes on these potential patients, they continue that patient assessment and gather additional information. And unfortunately, I don't mean this in any negative way. Unfortunately, we're getting very, very good at it.
That's good.
Yeah, I guess that's a good.
I wanted to go back to what you said about the PPEs, but are all firefighters? They're all equipped. Everybody that's on the transport, the ambulance and the fire trucks, they all have PPEs.
That is correct, Sabrina.
Okay, so I was just wondering because if people are asymptomatic and they respond, there was no way of telling that they may or may not have COVID.
No, very, very valid question. And so with the COVID-19, so we've also implemented protocols that we would, at the very least, regardless of what the patient call would be, we would at the very least be using a procedural mask, eye protection, and gloves. And as they do their doorway assessment and maybe a little bit more suspicious that this might be a potential PUI, they would then elevate those PPEs to the appropriate level.
Right. Chief, was this decision made, did it come from any place of we don't have enough PPEs for all the firefighters, so we're going to create 2 specialized units and give them all the gear that they need to respond to COVID? Was it that type of decision that was made with that logistic in mind?
Well, those are that was one of the points that we're using, but mostly the emphasis behind this was driven mostly about we want to minimize the exposure of the department. So if we have these 2 specialized units, as you said, doing those PUI transports, that shrinks the amount of people that can potentially come into contact. Most especially our first responders, who through just the information that we were gathering from the response in the United States and elsewhere, that if we don't properly protect our first responders and they wind up becoming infected, we've only grown that problem, and we've lessened our capabilities to help to help flatten the curve, so to speak. So a lot of decision points. Our first responder safety is the top priority for the Guam Fire Department, and so as I'm speaking through with my other chiefs, with that being the reason for these decisions is always going to be the safety of our responders. that's how we were able to come up with this idea.
What's the average amount of calls that you guys are transporting for PUIs?
So on average, we average on a daily basis between anywhere from 6 to 8 a day. That does go up and it has gone down. As a matter of fact, today I've received my briefing from our command post, and we're down to just 4 in the previous 24 hours. So although I'm very optimistic, and the administration has been leaning forward big time on this whole pandemic, I remain very optimistic, but as contingency planners, like I said, we always have to plan for the worst and hope for the best.
So that's 4 in the past 24 hours, possible PUI. Do you transport them to GMH or to a clinic?
That is correct. No, so all PUIs and or surveillance that are deemed PUI or surveillance go to GMH. GMH is the healthcare facility,
the COVID hospital.
PUI.
Now, do you wait for them and then bring them back home?
No, so they'll get turned over to GMH, and GMH will do whatever patient care is necessary if necessary.
What can you tell us about the? Not specifics, names, and all that stuff, but the general condition of these PUIs who are being transported.
Well, so again, they all for us, they won't be. There'll always be PUI. Not correction. That's not a fair statement. Not always. Those PUI patients, have been presenting with the standard symptoms and things of that nature, and so we take them over to GMH, and that's where they do the swabbing if they are classified for swabbing and determine if they are actually COVID positive or negative.
Or if they fit into the priority group.
Correct.
Right.
But are they like walking and talking and
Oh, I'm sorry. Yeah. So for the most part, I would say the higher percentage of our PUI patients are relatively stable. They present with signs and symptoms, but yes, like you said, they're walking. Most of them are fairly ambulatory, things of that nature. That's why out of the 136. The Guam Fire Department has actually handled a very smaller percentage of that, because most of them have either walked into their clinics or walked into GMH or GRMC.
Mm-hmm. And just for clarification, the COVID transport units, these are for just stable PUIs, not anybody that's exhibiting any kind of serious complications.
That is correct.
Okay.
Yeah, thank you for that clarification, because the COVID transport, like I said, are those seemingly stable. But if we receive a call and our dispatchers think, no, this is somebody who is in distress and needs immediate attention, then of course the normal protocols for response would be in play.
And then so when we roll out the normal response that's going to come from not from the COVID transports, are the firefighters at the different stations, do they have all the gear that they need to respond and be adequately protected from exposure?
Yes, that is correct, Chris. The one thing that we've also developed is in our supply chain, in the supply office, what they've done is they've taken all the required PPEs, the necessary PPEs for all of our responders, and we've built what we've called isolation kits or ISO kits, and that has the mask, the N95 mask, the gown, the gloves, the eye protection, things of that, everything that they would need to properly protect themselves from a PUI patient.
Mm-hmm. So you have these 2 COVID transport units. What about sanitizing these medics when you're done? How long of a downtime is that?
Well, and that's a great question, because that's kind of another one of the decision points that was taken when we taken into account when we made this decision, was the considerable downtime for the rest of the operational ambulances, so to speak. That kind of helped drive the decision that we wouldn't take those ambulances offline, because it was taking anywhere for about an hour and a half to thoroughly sanitize ambulances after transports. I mean, we do that on a regular basis with every patient that we transport, but there's a little bit more emphasis and detail placed on any PUI transports.
Okay. I did want to ask, because it was mentioned during the press conference yesterday, because we've increased our capacity to do testing. Still kind of trying to figure out just how many test kits we have. But one of the things that the governor mentioned as we move into this next phase was how the National Guard, they're going to start testing all their people, and police department, firefighters, everybody on the front lines. How are you going to roll that out in terms of testing all of your firefighters?
So the method that we're going to be utilizing is obviously the priority personnel that we want to have tested are those who have actually been out in contact with these potential PUIs and surveillance patients. Anyone that could possibly have come into contact, whether it would be at home or during their responses. And then we are going to eventually wind up, as those test kits start to roll in more and more, just wind up testing the whole department when we get to that point.
So how many do you plan to initially test?
Right now, I believe that the pilot testing that the public health and the Guard are going to be doing, I believe we're going to have anywhere from 10 to 20 of our personnel initially get tested, and then again, as more tests come in, we'll go ahead and continue to submit those names to get tested.
Is that an issue, Chief? Because you said when more tests come in, are we dealing with a test kit issue?
Well, no. So what's happening is if we have a high suspicion, or if one of our personnel winds up, say as the example, we roll into a scene and we get the call and it seems like it's a fairly routine call, if there's such a thing, and then we find out later that person wound up testing positive. Obviously, those responders would get tested, and based on the priority set, that they would be of a high priority for testing. So. Right. Those that have had those potential exposures have been tested already, and I'm very happy to say they've come back negative. Wow.
So no firefighter at all has tested positive.
That is correct, and we're very, very happy for that. And that's a huge testament to the safety mechanisms that we've put in place. Mm-hmm. With each one of these COVID transports, there's actually what we have is an infection control supervisor at the scene. They're not directly involved with patient contact, but what they do is they make sure so they're there as the extra set of eyes to make sure that our personnel are donning our PPEs correctly, and even more importantly, once they get them to GMH, mm-hmm. and there is the doffing of that equipment, because mm-hmm. that's where they're most susceptible, is when you're taking that equipment off.
Wow.
So no one tested positive. How many were tested?
So if I recall accurately, I need to get that number, that correct number for you. But we've had, I believe, 2 of our personnel tested. We've had to home quarantine a few of them. But once we got the results back from that particular patient contact, because we were a little bit concerned. Once we got the negative, through consultation with public health and our medical director, Dr. Jolie Nuggan, they said, okay, that's good for them to return back to work.
How many firefighters? How many people you have in GFD?
We're operationally, we are about 234.
Okay. So you tested only 2?
Two for because we had potential exposure.
Okay. How many again on home quarantine?
We had up to, I'll get you those numbers, Sabrina. I believe it was about anywhere from 14 to 16 of our people, and that wasn't because they were in contact with any that many patients. It was, we also had some of our personnel who were returning from travel, and because they were returning from travel from those areas initially. Out of an abundance of caution, we went ahead and placed them in the home quarantine.
Okay, so no one tested positive, but only two were tested, and with this new phase into testing, only 10 to 20 are initially going to be tested until more test kits come in.
Chief, do you want to see a bunch of your guys get tested? Are you satisfied with this 10, 20 here?
Well, initially, yes, because because there is a protocol for testing, and right now our crews are doing phenomenal work, and they're doing their very best to get it right all the time, and that's reflective of the amount of people that we have that are not positive. I'm sorry, that we don't have any positives. So they're doing their due diligence, and they're being as safe as possible. And I don't know what else I can say. They're just doing really great.
Yeah, I'm just saying you guys are front line,
right?
And it just doesn't seem 10 to 20 is enough, because you guys are responding to people who are sick asymptomatic for
I think you guys are
COVID.
right there with the nurses and the doctors.
Yeah.
Well, that's a very good point, Chris. And the fact is, we only have the initial amount of kits that are arriving, and so because Guam Fire Department is not the only one that is making patient contact of those kits, the governor wants to make sure that we're testing as many people as we can, but we also want to be able to share that test capability with everybody else that is coming into contact with these patients.
Chief, where are we on the hazard pay? Is everybody in the Guam Fire Department who is supposed to be getting the hazard pay getting it?
So that's correct. So everybody who is eligible for the differential pay, is that what you're referring to?
Yeah.
Yes.
Okay. So the announcement the governor had about, was it like 25% for first responders, and then there was like a sliding scale. All you guys are implemented, and we've seen that in the paychecks?
That is correct.
Okay. All right. Anything else, Bree?
I don't think so.
Okay.
I'll probably get a few text messages after this.
Chief, thank you so much for making the time. We hope to get you on. I mean, if there's anything you want to get out there, we want to get it out there. So if there's stuff that you want people to know about the COVID transport or, anything that's going on with the Guam Fire Department, you got our number, shoot us a message and we'll get it out as soon as we can, okay?
I appreciate it very much, both of you.
Thanks,
Chief. Of course, Chief. Wash your hands.
Be safe.
Thanks.
Okay.
You too.
Okay.
All right, take care.
All right. Chief Dan Stone of the Guam Fire Department. We're going to take a break, and then we're going to flick the big switch and jump over to KUAM TV 11. It's the KUAM News.
It's already 8 o'clock?
It's 8 o'clock,
Oh,
Bree.
okay.
Wow. You just got excited there. We're KUAM FM, Hagani, Guam. Good morning.
Este na palavra que vinota tau zaman sa sasangan na into mas manat sa kubiat sa niyo tusihan na tau.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-786.
taste land warm. Driving round, windows down, warm breeze and a soulful sound. I got my mind made up about where I wanna be. Can't nobody take my heart from me. There is no place like home. Saying goodbye to how gone. And I'm proud of where I'm from. Yeah, there's no place like home. Palm trees sway.
Oh man, it's different in quarantine, doesn't it? All of this is, I don't know, it makes me just love Guam so much more. I thought I had loved it as much as I could, but really just thinking about all the things we can't do, missing them so much, missing you guys. I miss you guys. I miss life.
I miss working out and running 9 miles.
I miss eating out.
Eating out.
I really took that for granted. It was just like, oh, just go get something to eat. Now it's like, oh, I miss life, you know. But we're gonna keep on keeping on.
That's right. We're in this together.
We're all in this together. We have the power to kill the curve. 807 and
Kill the COVID.
kill the COVID. That's our goal here. Containing COVID. Hey, good morning on you. We'll tell you all the ways that you can catch the show. Of course, it all started right here on the radio, 93.9 FM, Guam's favorite. We're also streaming on the KUAM News app and at KUAM.com. There's an audio stream at Docomo Channel 10. And, of course, on the KUAM News Facebook, thank you guys so much. Keep your questions, your comments, your concerns coming. We're going to go over some of those this hour. And also on KUAM TV 11, where we take the last half of the show. From 8 to 10 and bring it out on the TV again, Facebook-wise. If you guys could share the broadcast, there's a lot of information coming out this morning about the status of community testing. And the status right now is they're still coming up with the plan. The status kind of sounds like 8:08. So as we always do in the 6 o'clock hour, the 8 o'clock hour, we start with a deep dive into the day's COVID-19 news. So let's do it from the KUAM News team. Good morning, Sabrina Salas-Matanani.
Hafaday and good morning, everyone. According to the latest from the Joint Information Center released at 10:05 last night, Public Health tested 42 individuals for COVID-19 on Tuesday. 0 tested positive, and 42 again tested negative. Public Health's overall count, 136 cases have been confirmed through COVID-19 testing, with 5 deaths and 114 recoveries. The Department of Public Health will launch a community testing pilot program in Estumbo Dededo on Saturday. Here's Adriana Cutero from Tuesday's press conference, requesting more information from Public Health Director Linda DeNorsi.
I have a question for Linda on the community testing. Can you provide further details on the pilot project beginning this Saturday in Estumbo, a rundown of how it will operate, and then when expanding, how will the pockets of village areas be determined? Will village mayors be part of this process to identify high-risk populations? As they just found out last week, Friday, how many COVID positives are even in the village? And then how will people be receiving info on the community COVID testing altogether?
Yes, right now, as I speak, we had a planning committee that we mobilized, which includes public health and, of course, the other the mayor's council. Our representative was Mayor Savares, and we looked at all the details in terms of how the swaps are going to be done, and are we going to have the perimeters, making certain that it is well secured, making sure that we also have an ambulance there should anybody have any emergencies at that time. We're looking at a drive-through towards that perimeter that we are identifying and looking at just like you said, a pilot study. We're looking at a small sample size to start off with. And what we're trying to do is we're trying to involve not only the department but also other agencies that will be involved in this project, as you know. Of course, working with the Physicians Advisory Council and all this, so that we're all in line in terms of identifying and moving towards, of course, these pocket areas that you're identifying. We are working with the mayor's council, and we're looking at representatives of all this area. But I'm just going to elaborate for now on the pilot project that you're asking. And again, we're launching it so that it will meet our sample size. As you know, Dedido is a highly populated area. It also has high risks involved in the patients that are there. And we're looking at mild illnesses, patients that come in. We're doing case findings. That's what we're really focusing on. As you know, we're continuing our efforts with identifying the clinics to expand, and that will continue, whether they are seen at the private clinics, at the public health clinics, or even at the hospitals, both GMH and GRMC. In this particular case, it's case findings, and that's what we're elaborating on so that we can identify these mild cases, and they will eventually present themselves. We will notify the targeted group, and that will be done so that they know what form they're going to fill up and be prepared in having that form completed, and they will be notified through a flyer that will be distributed to them, and we're getting the mayors to be involved in that process. And so that in a nutshell is the activity, and of course working with other government of Guam agencies and the TAC, the National Guard, to maintain the perimeters, ensuring security and so forth. And so that's where we're at. And as the governor had indicated, that's what we're going to do, as she had indicated.
So just following up on, Governor,
I just wanted to ask if Dr. Cruz can chime in and how we're going to work together cohesively so that we move forward and end up being in line, and again, going to identify other individuals.
So this pilot study is going to proceed, but it's going to be a part of a larger overall community testing protocol that's going to be marched out. We have, again, as Linda stated, a planning session this afternoon with the Physician Advisory Council Committee, along with public health officials. And so she's going to identify this one pilot study, but we also want to make sure that the vulnerable populations, those are the, as the governor stated, multi-generational, multi-family homes, end-stage renal patients, those with significant comorbidities, frequent flyers to the hospital that we know that are coming back and forth to different hospitals, to either GRMC or GMH. These are vulnerable populations that if we don't identify, make sure that there's not a cluster or a positive within those particular communities, they will in fact be the ones that are going to overwhelm our healthcare system, especially the intensive care unit. So again, as we do this, there's going to be multiple fronts moving forward to ensure that we have cast a wider net on this community so we can get a better understanding as to the prevalence of the disease, so we can safely reopen back our island to, and it's
The pilot project in Estumbo is from 9 to 12 in the afternoon, again in the Estumbo housing area. Once we get more information, we will, of course, pass it along. Meanwhile, the governor, along with Guam State Surgeon General Dr. Mike Cruz, break down Guam's increased testing capabilities and a revised trajectory with input from FEMA and Johns Hopkins University that is expected to be released any day now.
Moving forward. So because of that, FEMA recognizes our efforts, and so they've readjusted our trajectory to saying that at the peak we would need about 40 bed capacity, and we can meet that now. As far as the 14-day, if we start looking at April, maybe 10th, 11th, where we are seeing mostly 0 positive cases and maybe 1 or 2, we can say that for the 14 days, we have sustained that slow spread of infection. And then, of course, testing, and what Dr. Cruz has mentioned about testing We have about 6 machines on island, together with GRMC's capacity, together with our capacity in public health, and also GMH's capacity. We will have the testing capability. We are also getting more test kits. Linda is being assured by CDC and also the World Health Organization that we would be getting 200 tests for our rapid testing this week, another maybe 200 again this week, and then we will be getting 200 tests every week moving forward. The other one is, of course, the PCR, which we are going to be getting test kits from that would continue doing about 40 a day. The rapid testing one, I think, can do about, hold on, let me just get this information so I'm telling you the most accurate one. Yeah, the rapid ID test, here it is. The ID now, if both machines with the test kits that come in can do about 124 a day. Then we have the BD Max, which GRMC already has the BD Max. Then the process of validating it, and also the test kits, and that's about 220 tests a day. So with numbers that are being done and with data that FEMA is looking at, they're saying that if we can have the capacity of 258 tests a day, that's a trigger to start lifting things up. So we will meet those. Also, the Gen Expert, we have that machine. That machine will give you results of about 284 a day. And then one is at public health and one is at GRMC. So with all this, we will, I think, meet the 258 sort of indicator that would trigger us to start lifting. So this is why I'm very urgent about launching this pilot project that we're doing in Stumbo to get us going in a better, effective, efficient way when we do expand it and open it up to more people. Additionally, my advice from Dr. Mike Cruz is that we need to also target more of the people that are also at a higher risk. Like, for example, those that live in multi-generation homes, those that are also our healthcare frontliners. By the way, the tag is going to be also doing testing for her soldiers, and we are also going to include the Guam Fire Department and also GPD in that testing. So we're going to start testing the population of first responders. So to your question, I know it's a long answer to your question, but yes, we do have the capacity. And once we start getting data, Kevin, from these testing sites, I'll be able to be more comfortable and confident, and also with Dr. Mike Cruz and Public Health to see how and also the recovery panel advisors. They get all this information, and we gave them our recovery plan. They're looking at it right now. And so once we get all that approved and finalized, I'm hoping by this Friday that the whole of next week we will be doing more testing so we can have a better picture of the community spread in our island.
Kevin, if I could just add one more thing to your statement. I think we'll probably in the next day or so share the reconfigured models on the projections as far as our bed capacity and the likelihood going forward. With FEMA's models and putting in the full mitigation efforts that the governor has implemented over the last several weeks, it shows there's been a significant decrease in the actual bed gap, or the bed delta that needs to be met. And we're pushing a peak and flatten the curve significantly over a longer period of time so that our healthcare resources would not be overwhelmed given the current FEMA modeling that allows for the full mitigation efforts that we've been doing here on Guam.
Yeah. And maybe there's a question out there about, you remember the initial trajectory that we were sending out. Those were done with little history and data. But now that we have actual data for over the last, I would say 5-6 weeks, we can now better adjust our trajectory and out the mitigation measures in consideration.
The governor is expected to finalize her economic recovery plan this Friday. It still has to be approved by Public Health. Additionally, Dr. Cruz said the new projection model shows a 60% decreased spread rate, which pushes and flattens the curve. He added that any peak that we may actually happen later in the fall, in the September-October timeframe. From the Department of Labor, based on updated guidance from the feds, those that are self-employed or self-contracted do not need to register as employers on the Guam Department of Labor's virtual one-stop system, HireGuam.com. DOL is actively working on a brand new module for employers to help businesses input employee changes due to COVID-19. From the Department of Corrections, the DOC recruit who tested positive for COVID-19 is expected to start back to work at the facility this week as early as today. DOC's Major Anton Uggan said the recruit has gone through the mandatory process, allowing him to be cleared and returned to training. On April 3rd, the recruit reported to DOC to control an outbreak at the prison. Public Health and CDC staff performed an on-site visit. Through contact tracing conducted by public health personnel, it was determined a total of 17 officers were in close contact with the recruit, and as of the day before yesterday, 11 have been cleared from the virus and 6 are still pending results. Also, when the recruit's positive results were reported to the prison, administrators directed all 38 DOC recruits and 10 correctional officers to self-quarantine at home. As of Sunday, 35 recruits and 5 correctional officers returned back to work. This week, DOC has implemented an additional precautionary measure by issuing masks for all inmates. That, according to DOC Major Anton Uggan. As for an update on the Theodore Roosevelt, national media report that the Navy is delaying plans to begin moving sailors back aboard the carrier after crew members have continued to test positive even after isolation. Reportedly, the Navy is temporarily pausing post-quarantine testing and extending sailors' isolation by more than 3 weeks. Earlier this week, Commander of Joint Region Marianas, Rear Admiral John Manoni, confirmed that several sailors who were in quarantine hotels in Tumon that initially tested negative have since tested positive, but would not provide a specific number. Meanwhile, 8 sailors remain at Naval Hospital Guam for COVID-19 symptoms, with 1 remaining in ICU. As of today, 94% of the crew have been tested. 678 have now tested positive, 3,904 negative, and 4,069 sailors have moved to shore. In national news, President Trump announced on Twitter last night that he is temporarily suspending immigration into the U.S. in light of the coronavirus outbreak. It comes as some states start easing stay-at-home restrictions. Ian Lee reports.
A handful of states are starting to reopen despite...
Democratic leaders say they reached a compromise with the White House on a nearly $500 billion stimulus package.
Staff was up all night writing. There are still a few more I's to dot and T's to cross, but we have a deal, and I believe we'll pass it today.
The bill will likely include $310 billion in additional funds for the Paycheck Protection Program. $125 billion of that will be reserved for rural and minority-led businesses. It also provides $75 billion for hospitals and $25 billion for COVID-19 testing. Minority Leader Chuck Schumer says the final sticking point was the money for testing.
You need a significant federal involvement. You need a national strategy, and the President and Mnuchin and Meadows agreed to that, to their credit, and that will be in the proposal.
The FDA announced it's authorizing a new test that will allow people to do a swab at home and mail it to the lab.
The White House says there are enough tests available right now for governors to start phase 1 of reopening their economies.
If they meet the other criteria of 14 days of reduced cases and sufficient hospital capacity to prepare for any eventuality that may occur.
The president also announced via Twitter last night that in order to protect American jobs, he's suspending immigration to the U.S.
He's going to look at how he can protect Americans both economically and protect their health. And so this is a temporary issue. just like the prior bans were temporary, and we're doing it to keep the American people safe.
Immigration and travel have already been restricted to control the coronavirus.
Pandemic. Beginning today through May 5th, first responders and healthcare workers will be able to receive a free thank you meal day or night via carryout and drive-through at Guam and Saipan McDonald's locations by showing a work badge. According to owner and president for McDonald's Guam and Saipan, Joe Ajuju, we hope this small token of gratitude offers a simple, feel-good moment to the police, firefighters, doctors, and nurse heroes at the front line. Chris?
Thank you so much, Sabrina. Good job there. And, while we're on the topic of Mr. Azuzu and the CNMI, let's go over to our man in the Northern Marianas, Tomas Maglotnia. Good morning, Tomas.
Hi, Tomas.
Good morning, Brain Chris.
First of all, if you happen to see Mr. Azuzu out there, tell him I said hi and thank you.
All right, I will.
I know you're not really seeing much of anybody, though, because you guys are staying home, but...
So what's going on?
Yeah, good.
Yeah, we still got that curfew, so people rushing home before 7.
Okay, so let's do it. Tomas Maglotnia and the CNMI with our latest report for this morning at 8:26. Good morning, Tomas.
Good morning. Here's what's making news in the NMI for containing COVID. The latest numbers from the COVID-19 task force from the NMI governor: 14 confirmed cases in the NMI, 237 persons released from quarantine, 2 deaths, and 11 confirmed recovered cases. And now we reached out to the CNMI governor's office yesterday asking about these 11 recovered cases. They tell us that all recovered cases were tested in the same way they were tested when they were confirmed positive. The CNMI governor's office also clarifying that a few of the recovered cases are still at the designated Kanoa Resort Hotel. They add that most are now home and continue to social distance and comply with NMI Governor Ralph Torres and the hospital CEO Esther Muñoz's directives to stay home and avoid unnecessary travel except for food, groceries, and the like. Stage C for this process continues to follow the CDC guidelines. CEO Esther Muñoz telling us that the South Korean pathologist now on the island of Saipan is training 1 lead and 4 techs. We also finally got a number on the cost for the 60,000 test kits acquired by the Northern Mariana Islands government, which would say is purchased with FEMA reimbursable funds. This morning, the governor's press secretary telling me that the total cost for 60,000 test kits is $2.1 million, including transportation. And now we know that there are currently 25,000 of those 60,000 test kits on island. We also know that Governor Torres requested United Airlines to suspend flights for the month of April, and they agreed. We know that deadline for the last flight, for the end of that cancellation for the suspension is coming up at the end of this month. And so we followed up with the NMI governor's office. They told us that United Airlines and the Commonwealth Ports Authority will be forthcoming on an announcement with regards to the suspension of flights, whether or not that'll be continued. Also, the NMI Fiscal Response Summit notes that the new summit start will be on Thursday instead of today due to technical difficulties. They plan to discuss from April 3rd to the 24th and next week the 27th to the 28th the fiscal crisis and solutions. There's a brief that we reported on last night put together by the Fiscal Response Task Force. And coming up tomorrow, we have a live interview at 11 a.m. on KUAM's Facebook and streaming platforms with the Coalition Against Domestic and Sexual Violence in the NMI Executive Director, Macy Tenorio. So, Brain Chris, that's the latest on what's making news in containing COVID here in the NMI.
Thank you very much, Tomas. If you could, what are some of the things that you're trying to track down for us today?
Yeah, I think the new information we got this morning, a lot of people were, wondering about what the costs were. So again, for the 60,000 Korean test kits that we received, hearing just a few minutes ago that the cost is approximately $2.1 million, including transportation for the total 60,000. And another thing that we're trying to work on is getting the Commissioner of Education, Dr. Alfred Atta, to speak with KUM News. We know that they announced last night that there's an emergency special board meeting today at 4 p.m. via Google Hangouts to discuss a loan from the Marianas Public Land Trust in an effort to ensure that teachers are paid. Yesterday they had a deadlock vote, and they're convening today in a special emergency board meeting. So we're hoping to provide updates as they come.
Yeah, Tomas, I know I spoke with you this morning before the show, and I was kind of thinking last night that so many of our people here on Guam were told to hang in there and to apply for food stamps, and we're going to kind of go into this with Nestor coming up, but now that it looks like we're not going to be getting that federal aid for the most part for several weeks, I think people have really reached a new rock bottom, if that's even possible. And so gauging what's happening here on Guam, I think we're still very fortunate in that we're not yet at that place where the CNMI is in terms of just the total economic crash that COVID has caused. What are you hearing about people just not going to make it through the year? Are you hearing that the people want to pack up and leave and maybe move somewhere else with families because there's just no end or anything positive in sight?
Yeah, Chris, it's as we continue to talk, the public knows they're at home, they're listening, they're watching every move that our government makes. And I got a chance to speak with one local businessman who actually did pack up and leave. And so we don't know if he's going to be coming back, but we know that he, put shutters on his door and, he moved with his elder parents. And so that's unfortunate and, might be the case for many more residents in the coming months.
Well, Tomas, thank you so much for keeping a track of everything, and good luck in getting the education guy over there.
All right, thanks so much.
Okay.
Ray and Chris, have a good day.
Okay.
Take care.
There you go. Tomas Maglotnia, of course, covering things in the CNMI for us. And we're going to switch gears and go over to Nestor Lecanto in just a few moments. But I wanted to play this clip from yesterday's press conference and also kind of just say our reporters are doing a bang-up job, man. Adriana and Nestor, I mean, they are just asking. We only got 2 questions, but the way they're trying to get this information, and all the media are really trying to deal with these limits on accessibility and transparency, I think it's to be commended. So we're going to play this from the press conference yesterday. It's KUAM News' Nestor Lecanto.
Go back to the stimulus check question. I know that you said that you're expecting money from the Treasury the first week of May, but I think that's referencing the $11 billion from the war claims. What about, I think it's $134 million that we had requested through the Director of Rev and Tax, Daphne Shimizu, to Treasury. When is that coming in?
Okay, so right now we are advancing that, Nestor, and so we are advancing the checks that we have already put out. And as you know from previous press conferences, that we had to decide how much we could afford and who are the most who are in most need. I know everyone is in a lot of need, but we had to have some kind of guidelines. So we identified those whose adjusted gross income is 10,000 and below, and or dual joint filing of about 150,000. So, 10,000 and below. So those we already sent out. The 134 million is calculated based on the 2018 filing, and so I think Daphne mentioned it's about 63,000 people, and so that's how they came up with the 134 million. That money we expect to be coming in first week of May.
Oh, okay. So, and then how soon after that will the checks be cut?
Right away.
When can people start to?
Yeah, as soon. See, the holdback in this whole thing is the implementation plan, which Daphne had submitted, maybe 3 weeks ago. And so we're waiting for that implementation plan to be approved. Once that plan is approved, they will distribute the monies to us, and then we can distribute the checks right away.
Thank you, Nestor.
Okay, so let's bring Nestor on there. And first of all, Nestor, I don't think you were done talking there, right?
No, I still was trying to clarify. Good morning. Good morning, Chris.
Good morning.
Good morning, yeah.
By the way. Yeah, I think...
Hey, no, sorry, can you just speak up a little bit, sir? Thanks.
Yeah.
Okay, go ahead.
Can you hear me?
Yeah, I can hear you now. Okay.
Okay. What had happened was during the press conference, as you know, we all get one question, one follow-up, and so one of the reporters from the Guam Daily Post, John O'Connor, who was a little bit before me, had asked her the question about the stimulus checks, because that's what I wanted to ask her about too. That was one of my backup questions, and she had mentioned during her response to John that what she had just said in that soundbite that you played, that they're expecting the 134 million stimulus check payment from Treasury the first week of May, and that kind of got my attention because I think a lot of people wanted to know, because ever since we found out that Guam was eligible for these stimulus checks, that was the question we were getting from people. Hey, when are we getting our checks? And so I thought that was pretty significant that she had mentioned the first week of May, which is less than 2 weeks from now. And so that's why I asked her the follow-up question, and then I asked her, so when, and then she responded, as you heard, that we can distribute the checks right away. And so I just wanted to get clarification from Adelup, and we talked a little bit last night, and so did you confirm it again that the governor does expect the $134 million that was contained in the implementation plan submitted by Revenue Tax Director Daphne Shimazu by the first week of May? But they wanted to, what the clarification they wanted to pass on was the $11 million that they have paid out or are paying out in locally advanced stimulus checks is part of that 134 million.
Right. Now, so when John O'Connor asked that question, the governor's response to it was that I think she said something like, we're already paying out the stimulus checks. And that later had to be clarified. I had to shoot a message over to the Adelup press secretary and say, hey, the governor kind of made it sound like, stimulus checks are getting sent out, but they're actually not. That's an advance payment to those who earn under $10,000 or less. And she said, yeah, Daphne is correct that we're still a couple weeks away from actually implementing this program.
Right, and I think they're waiting for the money from Treasury to revert. And I don't know what those specifics are. If Treasury is going to, electronically transfer 134 million or to one bank or to several banks, or is it going to be I don't imagine it'll be a U.S. Treasury check. I imagine it'll be a check issued by the Treasurer of Guam. So I don't know what the details are going to be or how quickly they're going to be able to get those checks out once the money is received from Treasury, and how long it will take to clear, because I imagine a lot of people will want to cash those checks right away so that they can start purchasing stuff. So, yeah.
Man, Nessa, I want to go back to, I want to say it was 2-3 weeks ago, one of the consistent questions that you were asking, that a lot of media were asking, that I was asking, was what are we going to do in the interim as far as local assistance? And the answer we got was, first it was hang in there, and then it was go apply for food stamps. We heard from Lieutenant Governor Josh Tenorio that over 1,200 new people
applications were approved.
Right, are approved and for the SNAP benefits. But I think a lot of us were
wait. No, I was going to say it's not just SNAP; it's Medicaid and other.
Right, and yeah. But I think a lot of us were kind of thinking that the money was going to come, yesterday. And so now when you hear that it's still a couple weeks away, and, I'm engaging that with everything else they said, I mean, whether or not it really is a couple weeks away remains to be seen. She also had said stuff about the PUA and the FPUC also being several weeks away. So I don't know, do we kind of need to renew the question again and say, hey, what have you done everything you could to give the people some kind of bridge assistance here, or?
Yeah, I mean, I don't know if there is any bridge assistance that's going to be available at this point. I don't know if there's money in the bank, so to speak, locally to be able to fund those, or that's some cash that's being held for other purposes, like to cover, payroll,
right.
services, that sort of thing. We don't know. There's been no mention of any bridge. What has been mentioned is what you just said earlier, that it's the SNAP, the Medicaid, and those are all pretty much federal programs.
Right. Yeah.
And we've known all along that the primary source of our assistance is going to come from the federal government.
Right.
but I thought it was significant that she had in mind the date already for when she expects to get the 134 million for the federal stimulus checks, because people are waiting for that 1,200 and 2,400 and 500 for the kids.
Right. Yeah. And so, I mean, that's when she answered John O'Connor's question. She had said, like, yeah, the checks are going out. I think even the kids are getting them. And you saw it real time, Nestor. If you go back and look at the comments, people were, because, again, like Tomas said, we got nothing else to do but to sit here and pay attention. People were kind of like, hey, that's not what's happening. No, that's... And then some people were like, are they sending them out? So it's just a lot of confusion.
Yeah. Well, just to be clear, you're right. What is going out right now in the form of so-called stimulus checks are local advances. And that's amounts to about $11 million. And that's what I wanted to clarify with her. So the money that she said was she was expecting to come in on the first week of May, is that the $11 million that's due from Treasury for the war claims reimbursement, or was it the $134 million that Daphne had put into the implementation plan to Treasury? And so she responded with that she's expecting $134 million on the first week of May, which is about a week and a half from now.
Okay. And so I understand that there was some clarification that had come down, Ness, and this isn't the first time where, the Adelup staffers and the advisors have had to go around after a press conference where the governor says something and then kind of like clean up what she said. Was that what happened with you? Because it's what happened with me and what the governor said during the press conference. I had to go shoot a message over to Crystal and be like, hey, did she really say that? And what does she mean?
Yeah, it's just, let's just call it just clarifications that we typically do as part of our job
right.
as reporters.
Right.
Just need to make sure that we get it right. And that was important that I knew exactly what the governor meant, because I didn't want to put out there something that, because as I mentioned earlier, a lot of people are waiting for this and have been waiting for a while.
Okay.
So I wanted to make sure on that day. But if we got time, I do want to mention a couple of things.
Could you just speak up a little bit? Sorry, we're just having a problem here.
Sorry, must be my connection here. So I just wanted to mention a couple of things that also have to do with assistance. The Senate passed today another stimulus package, $485 billion. $60 billion will go to the Economic Injury Disaster Loan, the EIDL program, and $310 billion to the Paycheck Protection Program, the PPP. And I think a lot of local businesses have applied for these. I just want to let them know that the House still has to sign off on it, which will happen Thursday, Friday, our time. That's what's projected, and the president has already indicated that he will sign it. But they need to go to their banks now and let them know, because it's going to be like last time. This thing, according to the pundits, will go pretty fast. So get your applications in order, as Ken Luan said, and go see your banks and let them know that you want to apply for these two particular.
Right. Bring them donuts and coffee.
Bring them donuts and coffee, yeah.
All right. Okay, Ness, thank you so much.
All right. You guys stay safe. See you soon.
Right. Nestor Lecanto from the
Thanks, Ness.
KUAM news team. Hey,
Are you unmuting me?
No, just because it was hard to hear. I'm practicing for a job at Adelup where there's mute people. You know, that was interesting. When we played that clip, you could hear people whispering in the background.
Yeah.
So was that us or was that them?
No. That was the Adelup people.
Okay.
No,
okay.
it wasn't.
Probably like mute that Nestor Lecanto.
No, that wasn't Nestor, because Nestor was asking the question.
Right. Yeah. Interesting.
You hear them sometimes doing that.
Yeah. It's 8:44. We're gonna take a real quick break, and we got the superintendent of the Guam Department of Education next, right here on the KUAM News Takeover of Guam's favorite, Containing COVID. Good morning.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Holiday, this is Ryan Clowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information. Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hoffaday, I'm Jonah Gonçalves, Senior Producer for KUAM News. And I'm sure you are probably tired of hearing it, but I'm going to say it one more time.
The Superintendent for the Guam Department of Education, John Fernandez. Good morning, John.
Hoffaday, Chris.
Good morning.
I guess just first of all, how are we doing on the grab-and-go meals? And, thank you again. That's an awesome program. It's a huge undertaking, but like I always say, this is one of the first things you guys thought about when we got those 3 positive cases. And when you talk about COVID heroes, I mean, you guys are out there every day feeding people who need food, and it doesn't get much more heroic than that, John. So what can you tell us about just the status of the program and I guess the roundabout info?
Well, I mean, I think first of all, I mean, you're right. I mean, a lot of the employees that are out there at the school sites, they include our administrators and our staff. We're really thankful for them for continuing to step up. We didn't want to force anybody to come out and do this job. We wanted people who were willing to come out and recognize that there are some risks associated with it, but we're going to take protective measures, and we just need them to have a good attitude and be willing to work with the community. And so we've had our staff out there, and we're producing 12,000 breakfasts and 12,000 lunches every day. And it seems to be going smoothly. Over the last week and a half, we did have a hiccup at some point when there seemed to be toward the end of last month, just really excessive demand, and we were running out of food. But that seems to have calmed down now, and it's been pretty smooth for the past several days. So I think the big decision for us right now, and we've been in touch with the governor, lieutenant governor on this, is typically we serve our school meals right up until the end of the school year, which is about the third week of May. And the question is whether or not we can continue that service at least through the summer until school starts again. So we do have the flexibility to do that. The federal agencies and USDA gave us the flexibility to do serving over the summer. The problem is we don't normally budget for that. So we've been in touch with the lieutenant governor and governor to let them know that we can do it, and I think the governor wants us to continue. And then we're just ensuring that whatever local funds need to be, or whatever funding needs to come forward to be able to support that can be assured, so that we can make sure we're paying our bills. So we estimate that'll be probably about $1 million in the additional support that we'll need. But we're able to, under the waiver, be able to continue the food service probably up until August 7th, which is the last day of summer for us. So that's the next phase, and we hope that we'll get everything lined up and be able to make that an official announcement. But we do think there's a need for food service and food support, and that's definitely been shown by all the people showing up at our 12 school sites.
Yeah, and it's just kind of crazy that there hasn't been anyone else from the government to kind of, step up and...
Well, we have this other food support program. I don't know if
the commodities one?
The commodities one. And this is something when I first came on board, I wasn't sure why the school system was running it. It seemed to be more like maybe a public health type of support or through the SNAP program or so forth. But it ends up that we're running it, and so right now with the government, the U.S. government, the federal side has provided more support to the emergency food program. So we're seeing, I think we had about 18 containers lined up coming in, and then I hear an additional 29 containers of food coming into this program later this summer. So we've been able to work with our nonprofit organizations. We've been working with our partners in the government at GORA and the mayors to do these distributions of commodities out to families in need. And this is separate and apart from the school meals program. So that was our first round of distribution. The senior centers, the GORA housing set of locations, and then also through Sanctuary, Catholic charities and so forth. And we're looking forward to planning the rest of the summer and trying to make sure that we hit those gaps, those either villages that we have not yet been able to get the commodities to, and other. We're looking at maybe working with Department of Labor if there's any things that they're working on to reach out to the recently unemployed or furloughed, be able to maybe pair up and see if we can get food support out to those families.
How are those food supplies being distributed?
So we normally have these food supplies coming in, and we have been doing these distributions normally maybe twice a week down at our PD warehouse. But because of the emergency measures, we just can't afford to have people line up down in PD, under the same operation. So, and then of course during this particular time, we think the need is more widespread over across the island. So what we've done is we've got these commodities. I mean, these are just packages of food that can be prepared. So either canned goods, bags of rice, things like that. We bag them into so we can bag combinations of these foods together, so that we can give families and individuals a variety of those commodities. Typically, it is based on need, and we typically have work with public health to go through an identification and signatures by these households. But under the new rules and flexibility given, we're not necessarily going to have to go through that cumbersome administrative process. We'll be able to work with organizations and mayors to really, who know the community and who know the areas of need, and have more flexibility in giving them out to those families who need it, and without having to go through the bureaucratic processes.
How many families are you guys feeding through this program?
I'll get the totals, but we have another round that we're about to push out, and they're saying that this next push, which is probably a couple weeks worth, is about 5,300 individuals. So
wow. Thanks. That's great. My auntie, John, my mom's sister's, she passed from cancer, but she was on getting commodities. I know that we're all struggling, and it was something that she was able to avail herself of. And I mean, it goes a long way, and I can't even imagine. I mean, it hurts to wrap my mind around all the people that need that. So for you guys to be able to reach out to, over 5,000 families, it's just phenomenal.
And that's just currently in this program.
Right, and we have a lot more coming in. And I think for us, we did the school meals, and the school meals are basically prepared meals. But we also know that in this particular time period, people are trying to conserve, they're trying to stretch resources out over time. So having the commodities available that you can bring home and prepare at your leisure, stretch it out as long as you can, that gives these families more control of those those resources. And again, we're listening to the news, we're monitoring. We understand that federal relief may not just kind of show up at your doorstep right away. So whatever bridge support we can provide between now and when the resources come in to support these families and households, we're trying to do our part.
Okay. Are you guys looking forward to, not looking forward, but planning for the possibility of what might happen next school year?
Right. So, John, that's I wanted to ask you, too. So Dr. Mike Cruz came out and released this, and he kind of just glossed over it, and I think they're going to really present more details today, but he said new peak September, October. That's like right at the start of the school year, so.
Right. So, of course, we're watching what's happening with our team, and we're watching what's happening in other states and paying attention to the debate. I think, a lot of this recovery is being talked about as an economic recovery, but I'm pretty certain, and I feel strongly that the K-12 decisions and what happens with the school system is going to be very important to that. Because as you know, with all the kids at home, all these parents who can't work or have to get childcare, a lot of that's going to impact the economic side when people try to return to normalcy. So we're trying to get our plans together. It's all going to be based on health and safety. We're not in the business of, I know that's the governor's job, but we're not in the business of balancing the economy with safety. We're going to have to say, look, safety first. We got all these kids. So we're going to be paying attention to public health and what they say is, in terms of how we operate. And we're already planning for different contingencies. One is normal operations. Another situation is whether, if we can come back, but we have to maintain social distancing, and that might trigger, having to stagger school schedules. Or three, having to prolong the distance learning approach and to strengthen that so that we're not simply trying to salvage the school year, which I think a lot of states and districts are doing right now, but really doing it in a more robust way and purchasing the equipment, helping kids connect back, at home, and ensuring that we can address the grading and progress of our students when they come back. So we have to do all of that planning, and we're doing it now. But we also have to do it in tandem with our public health officials as part of the recovery effort.
Right. Has there been any discussions with public health then if school resumes after summer that there would be any sort of like mandatory medical screenings, testing?
Right. All of those things are going to be part of the discussion. So not yet with public health. We know they're working on the public health side of the testing and trying to deal with their cases. I did reach out and talk to the Lieutenant Governor. I said, look, as part of your economic recovery team, I know that you're going to want to know where K-12 is at and also have that dialogue. So we're ready and we're standing by. But again, when people come back to normal, it's not going to be normal, right? It's going to be a new normal. And things like the availability of personal protective gear for all of our employees will probably be among the top requests that we're going to get. And, knowing that there's a shortage, we have to start preparing now for what happens. Will we be able to get a supply of that type of equipment, as well as dealing with the other operational, issues.
What about like deep cleaning of the schools before kids go back, if they do go back?
Right. So that's we've already gone through a round of that. When we closed down, that's the first thing we did with our custodial groups. We said, look, we're not likely to come back, so proceed with deep sanitation and cleaning of the classrooms and facilities. And they've been closed since then, except for the food services. So obviously we'll do what we can to prepare the facilities as well over the summer. Additionally, but again, there's just so many things hanging out there in terms of the possibilities of, like I said, we've got to get plan A, B, and C lined up. And then hopefully as we go through the next few weeks into May and early June, we'll have a better picture of what we'll be able to plan for as the new normal for the school year. And so we'll be working closely and have to be working closely with the governor on that plan.
Okay.
All right. John, anything else you want to add in closing?
No, I just want to encourage. Thank you for getting the information out. We do have this online, web page for all the parents out there looking for the teaching supports and, activities for their kids to do. So we've expanded that to the grab and learn, school distribution processes, and then also PBS University. We just launched a televised version of these lessons with the PBS KGTF. So we're hoping that people will also use that as a resource to keep their kids learning, not just through the rest of the school year, but over the summer. So hopefully we'll continue to get that word out.
Cool. We'll do that. John, just again, do you have any numbers on the grab and go meals? Just maybe like a weekly. How many do you guys give out a week? And then I could do the math going back.
Yeah, so it's 24,000 total meals, right? Breakfast and lunch every day. So we're talking about $50,000 meals. Every couple of days. So, we can, I think we already got over 500,000 for the weeks that we were open, and that was about a week ago. So we're going to be approaching probably 1 million, 2 million by the time we hit the end of the school year.
Again, John, getting kind of choked up here, but I can't thank you guys enough. I know that it wasn't just you. Like you said, your staff is out there. Obviously there's a risk, but the need is so great. And I think that, sometimes you got to no risk, no reward, right?
Yeah, well, there's a lot of commotion out there about the right way to go about doing this. But I think we're with the numbers that we're seeing, and hopefully the expanded testing, the community as a whole can feel more positive about just continuing to do their part to prevent the spread of the virus, and hopefully we can get out of this much earlier than projected. So hopefully we can all do our part to throughout the community.
There you go. Thank you, John.
Thanks, John.
Hey, thanks.
Wash your hands.
Take care.
Right, bye-bye.
Okay. Superintendent John Fernandez. Man, the things he's saying, Bree, about bridging, people finding a way to get them fed until this federal money comes out, talking about how they need to get these commodities out to these families. It just resonates so much with me, and part of it is because we're not hearing anything like that at all coming out from Adelup. All we're hearing from Adelup is, how do I get more authority and hang in there and apply for food stamps? And, it is what it is. I just don't know why they don't deputize someone or fold, John Fernandez into the loop, because obviously it's huge. And as much as DOE is doing in terms of how many meals they're providing, I hate to say it, but there's still more people out there who need the help. So.
And the longer this drags out.
Yeah, the longer it drags out, and, we were told to hang in there. And
there's no assistance. Local assistance.
Yeah.
More people are going to hurt.
Yeah, and it's hurting. 9:05. We're going to take a little break. Peggy Denny is going to come on to wish us all a happy Earth Day. And talk, yes, it's Earth Day.
It's Earth Day.
Yeah.
Oh.
Yeah.
Ding, ding.
Earth Day. Just trying to give you some kind of normal here, guys. Just a little bit of normal. Can we just get 5 minutes of normal?
Okay, 5 minutes of normal with Peggy Denny.
And she's doing stuff with COVID-19, and they're rolling out a new program that she's going to tell us about. Right. And then we're also going to get a prominent local businessman on the line and get his 2 cents about the governor's recovery plan. Apparently there's
should be finalized by Friday.
Should be, and we'll see. It's 9:06, containing COVID, the KUAM News Takeover, Guam's favorite. We are KUAM FM, Hagatni, Guam. Good morning.
Banners.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Holiday, this is Ryan Clowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
Buntimas Malik hanggang sumaga au gigima, maila datafan safu.
Send this one out to my buddy Ryan and Matala, Surf the Bay, the great jam. 9/11, Guam's favorite. Happy Earth Day. Let's get Peggy Denny, our local Earth Day superhero, on the line. Good
Happy
morning.
belated birthday, by the way.
Peggy?
Oh, yes, I'm here.
Okay, happy belated birthday.
Oh, well, thank you so much. It was a little strange, but it was still good.
Yeah, I think we're seeing a lot of strange birthdays in the last month or so.
Yes, exactly.
So happy Earth Day, and I'm just wondering, mentally, what are you thinking about on this Earth Day, given that this is obviously the weirdest Earth Day ever? You know what I mean? So where are you at now, Peggy?
Basically, we being iRecycle, want to launch an effort to encourage people to separate out their aluminum cans from their trash. Do not throw them away. Aluminum cans are one of the, if not the only valuable recyclable or household recyclable that we have, and I hate to see them all go in the landfill. So we're just encouraging people to separate them out and bag them, and then when the schools resume, then they can take them to their school to be recycled through the iRecycle program. there's really no need for us to be throwing those away. And even though we're not promoting that people take them to the schools right now, because they do need to stay home. If someone has a backyard full of bags of cans, this is something that I am striving to do, but it just takes one person. I go pick them up, and I can take them to a school that I have access to. But this is not something that we're encouraging people around the island to do. We just want them to save them and not throw them away. We did receive a payment just in the last week or two on our for our 20th container that we shipped off in early February. And so I am working on the breakdown for the schools to have payments ready for them so that when the schools resume, I can deliver payments to all the participating schools.
Peggy, are you finding that people are producing more garbage now that we're all staying home and we're consuming a lot of food, we're cooking a lot of food?
Chris, I really don't know that for sure. I'm assuming that people have not stopped drinking beverages, whatever the beverage is, in an aluminum can, and I just don't want to see them go into the landfill. We're having a truly challenging time with plastic, and that is one thing that I would like to encourage people to do, is to stop drinking beverages in bottles. I just was reviewing a site that says that we in the United States consume 73 billion beverages in plastic bottles a year. And I mean, that is just mind-boggling. We need to make a proactive effort to reduce that number significantly, because we now have no place to ship our plastics 1 and 2 to. And so that means that everything that is being generated, for a while it's been baled and stockpiled at Pyramid Recycling. They are the recipient of the plastics generated in the curbside recycling and the transfer stations. But with the curbside recycling not being picked up and people being advised to just throw all that away, put it in their household trash, then the amount of that going into the landfill is going to increase substantially and certainly diminish drastically our efforts to try to reduce the waste going into the landfill and extend the life of the landfill.
Peggy, are you on the Solid Waste Authority board?
Yeah.
So they decided that they were going to stop curbside recycling?
Well, that is the position that management has taken. I had a bit of a challenging time because I lost my phone, and so I couldn't access anyone because I also tether Wi-Fi with my phone. So I was a bit incommunicado for a while, and I missed a GSWA meeting. There is one coming up this Friday that I definitely will be able to attend, via Microsoft Teams. But if a decision was made at that meeting, then I'm not aware that the board was actively involved in that decision.
Wow. This is one of the side effects, Peggy, of the suspended the open government law. So, we don't know what's going on.
Well, and I'm not saying whether or not the board was involved. They may very well have been. But it's important to understand that the concern lies with those individuals at Guahan Waste Control, aka Mr. Rubbishman, that are required to sort through all that material that comes from the curbside recycling and the transfer stations. And because they don't have the appropriate PPE that they should be wearing while they're doing that sorting, including the N95 face masks, then they have decided that they're not going to put their employees at risk and that's why the curbside recycling is
I
not
see.
being picked up.
I mean, there
It's just a
there is
rippling effect.
there's a risk, right? Because we've seen some of the science on how long this COVID-19 can survive on surfaces.
Exactly, and that's what they're concerned about, and so I certainly understand their decision to not proceed with that at this time. But if we, and I really don't know the likelihood of finding an entity that will accept our plastics 1 and 2 for recycling. And I think that we're going to have to be far more aggressive in reducing the plastic that we generate, and hopefully finding some means of processing it here into something that could be a viable option.
I think we just got to start plastic shaming people.
Well, and one of the things that people are often concerned about is they think that they're concerned about the safety of our water, and they really do need to be aware that our water meets US EPA water quality standards, and they really need to be drinking tap water, and if they don't like the taste, then I just encourage them to get a filter. But also, we need to keep in mind the volume of trash that we are generating with this current situation with plastics and our inability to recycle them. Then, Chris, I don't know if we need to do plastic shaming or if we need to try to be more positive and encourage people to use reusable water bottles and flasks. Take a stand and be proactive in assisting the island with this challenge.
Peggy, you do the nice way, I'll do the plastic shaming.
Okay, that's a deal.
Two-prong approach.
But getting back to aluminum, like I said, aluminum is really right now the only valuable recyclable we have that's generated at home, and we don't want that going into the landfill.
Right.
Now, the general manager, Larry Gast, commented that the ability to recycle is severely impacted, and that these various recyclables are not being accepted for recycling. Anytime there's any sort of an economic crisis, that impacts the need for and the value of recyclables. But it takes us many months to fill a 40-foot container with baled aluminum. And I really do feel that by the time we have sufficient bales of aluminum to fill a 40-foot container, that this whole crisis will have been resolved, and we will be able to proceed. So that's why I want to encourage people to separate out their cans and just wait till the schools resume. I did have an opportunity to speak to Dr. Kelly Sokola yesterday, one of the assistant superintendents, and she did say that once the restrictions are lifted, then the schools will reopen at least with their 12-month staff. And so we will be able to take cans to the participating schools. And just so you know, we now have 48 schools participating, and we are planning on shipping in one more shipment of 12 of the 6 cubic yard plastic recycling bins that we had been putting out at the schools to replace the old metal bins with, so that we will have 60 schools participating in the iRecycle program. And so Glimpses, a partner of iRecycle, has created some awesome maps of Guam that indicate where the participating schools are. And so that's something that we will be promoting aggressively as well, so people do know where they can take cans to the schools. And I'm also more than willing to help those entities or individuals who have more than they can handle. So it's just something that we need to do. You know, it's the right thing to do, and it's a good thing for Guam, and it's a good thing for Guam schools.
Well, Peggy, I want to thank you for calling in, and you're right. This is something that there's so many ripple effects of COVID-19, and this is something I didn't even think about it, and so I'm glad that someone is keeping track of it, and I'm glad it's you.
Well, I mean, people are keeping track of it, but iRecycle just really wants to push this so that we at least reduce the aluminum cans going into the landfill. And one other thing, if I could just add one more comment. We have not had an entity that is accepting paper for recycling, as well as paperboard, which is like cereal box type cardboard. We haven't had one to ship those materials to for quite a while. Now, GSWA did not make an announcement to the general public or those receiving curbside recycling service because we didn't want to change that behavior. But those materials are having to be separated out and disposed of in the landfill. So what I have been trying, myself and others have been trying to encourage people to do is to shred it and to use it for mulch, to use it for composting, to use it for bedding chickens and roosters, you know, so that we divert that material from the landfill, but make use of it, you know, in our own homes and gardens and farms.
We do have a question from one of our viewers. You mentioned the aluminum cans. What about metal cans? Should they also hold on to those?
Cans, yeah, I have heard that Global Recycling, which has been a metal recycling facility here on Guam for years, closed down for a month. But I know that Pyramid and its sister company are still accepting metal, and metal is a valuable recyclable as well. Not as valuable as aluminum, and the value has dropped significantly, but those can be separated out. You can take them to the transfer station as long as the containers or their big roll-offs are not full. Once they're full, then they are going to be taken to the respective entities, you know, for recycling. That then they will not be available until the restrictions are lifted. So I would encourage people to take them to the transfer stations as long as they can, and then save them, and then take them, depending on where you live, take them to Pyramid or their sister company for recycling.
All right, Peggy, thank you so much, and I want to wish you a happy Earth Day, and wash your hands, okay?
Well, if I must. Okay, thanks so much.
Okay.
You too. Have
Take
a
care.
wonderful day.
Bye, you too. There you go, Peggy Denny. 9:25. We'll take a real quick break and continue with containing COVID after this.
Full price. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD. KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Hi, everybody. This is Ryan Clowers from Crescent Fitness. This is a quick public service announcement. We want to remind everyone, please just stay home. Go kick back in your pajamas, like we're doing. Go spend time with your kids. Go do the things that maybe you've been kind of just forgetting for a while. Go get a workout in. But the big thing is, please stay at home. For the sake of your kids, your family, and your future generations, please stay home. Evan, what about you?
Stay your butt home.
Coming in, you know we gonna rise now. Blessings coming in, you know we gonna rise now. Blessings coming in, you know we gonna rise. And you feel it in your mind, and now we now waste no time now. Blessings coming in, you know we gonna rise now. Blessings coming in, you know we gonna rise now. Blessings coming in, you know we gonna rise.
Hey, we got a new message, guys. Get tested.
It's free.
It's totally free. No insurance, no problem. Okay, that's the new message. I know that we've been telling you guys, stay home. But the new word from Dr. Hoa Nguyen of the Physicians Advisory Group, the governor's group of doctors that advise her, he says now if you are exhibiting any of the following symptoms,
basically the COVID symptoms.
Right, and mild, but they're saying any one is what they had said in the press conference. So whether it's loss of, is it loss of taste,
loss
sense
of taste,
of smell,
shortness of breath, cough, flu-like symptoms.
Right. So then you would then call your doctor. There's also a public health clinic in the north and the south, and again, it is free. Testing is free. It doesn't matter if you have insurance, you don't have insurance, Medicare, Medicaid, whatever. No insurance, no problem. It's free.
Yeah.
Okay, total demo free. You guys like all the free stuff, so let's go get a free test kit. Get tested. COVID-19. That's what we're gonna do. We've done our part to stay home and kill the curve. And now the people in charge are telling us that they want to test as many of us as they can. And, of course, the governor came out and said 258 tests a day this week. It's already Wednesday. So we got to do our part. You know, they had said last week, oh, nobody wants to get tested. So just letting you guys know, it's free. Okay, so call the clinic. And if you have a problem, because they've expanded the criteria before, if you went to get tested and you had any one of these symptoms, you probably wouldn't get tested.
You were told to stay home, isolate for 14 days. But they moved into this next phase where they're trying to find out the prevalence of COVID-19 out in the community.
Right.
So again, if you are feeling any sort of symptoms such as cough, fever,
loss of sense of smell, taste.
Yeah. Any of the COVID symptoms, you need to call your doctor
and get tested. Okay, it's okay. All right. I know they said stay home, but now they're saying we've increased our capacity to where we need to be, and we're not going to be testing 15 people anymore a day or through the weekend. And so let's do our part again. We got to make sure we do our part. And government, they're going to be the government. That's just what they do. They're bumbling. They don't, whatever. Well, we have the power, so let's do our part. Let's get tested. And let's go to Jigo now. One of my favorite mayors, Mayor Rudy Matanani. Good morning, Mayor.
Hey, good morning, Chris.
Got Sabrina here, too, and I know that...
Hi, Sabrina.
Holiday.
Yeah, she's from Jigo.
I know, yeah, so you're the first mayor. She's like, get Mayor Rudy.
Hey, Jigo rules only in Jigo.
Mayor, so I know that during this press conference, they had thrown out a few different locations in Jigo. Can you just tell us, have you heard anything from Public Health, the governor's office, or, maybe the mayor's council president?
Okay.
Go ahead.
I spoke to Mayor Melissa yesterday, so I'm waiting for Dr. Denorsi to let me know when we're going to start testing in Jigo, because they asked me if we could test for the coronavirus up at the gym, and I okayed it. I feel comfortable that that's what we should do. As soon as I said okay, I called my municipal planning council members, and they all backed me up 100%.
And so is it going to be like a drive-through type of process?
Yes, it's a drive-through.
Okay.
Drive-through at our gym.
Okay.
So, I hope that the people of Jigo are anxious to get this done, because I really think that this is the right thing to do all over Guam.
Did they tell you, how many people they were trying to test, or is it going to be just for people that are...
I haven't gotten the details.
Nothing.
Actually, I haven't spoken to Dr. Denorsi, and I'm kind of anxious to talk to her, to see where we go from here.
So all you know is, okay, it's going to be at the Jigo gym, but you don't know when, how many people, anything else. That's it.
No, not yet.
Mayor, what are the residents of the village saying? Because we spoke with Mayor Kevin from Agate, and he was saying basically what they found out when everyone else found out.
Well, up here in Jigo, man, people are quiet, and I know that there was about 17 or 18 that were tested positive, and I think about 10 of them have gone through, and they're good now. So, wherever we're at, we got to move forward and finish the testing and be safe. And I heard that there were actually, I think it was yesterday or the other day, they were talking about, everything is okay. That is the worst thing that we can do. And, if we think we're okay and everybody's gotten tested, I really think that we should just give this like a month or two, to make sure, because if we kind of jump to conclusions, that might be the worst thing we've ever done. I always want to do the right thing, and I think that being sure, always sure about the health of our community, I think that that's the best thing to do. Moving forward too fast is bad.
Mayor, what you're saying is that these zero positives that we've had the last week, night after night, I mean, it's so sure you could bet on it. You're saying don't take that to heart. That still we got to take this serious.
I would like to, but it's not a safe thing to do. Chris, what's the percentage of the people that have been tested here in Guam?
It's pretty low. Yeah, not really a math guy, Mayor, but it's low.
Let me tell you that even if it's 100%, we still have to be cautious. This thing might just come back and bite us in the butt, and we cannot regret it because we're all gone. I hate to say that, but be precautious about things like this. Our leaders, I don't know. This thing is dangerous, man. This is like not any other.
Right.
And it's a silent one.
Invisible.
Yeah. And I want my people to be safe, man. I've got grandchildren that I love with all my heart, and they're all over the place, so I'm speaking for them. And they're from Jigo all the way to Chalampago, and I care about them. I care about my people. I got a lot of relatives here, and I hope that they're hearing me, everybody, most especially the leaders, that we should be careful about this because we're speaking for our people. And we gotta be more than 100% sure that we're safe, man. And I don't ever think that we could ever, be 100% sure until we give it time. So, I'm anxious for Jigu to get tested, and I hope that the people, are for it because it's the right thing to do.
What do you think, Mayor, though? You think that people are, scared to get tested? Because we're seeing that in some of our Facebook comments. People are thinking that, they get tested, they're going to get put into isolation, or, and people, I think, generally, especially in the islands, are kind of already a little scared of going to the doctor. But we need to overcome that. We need to get tested, right? You know what?
I'm scared too, buddy. I'm scared. But I think that getting tested is the right thing to do. Hey, if you're positive and you go through the treatment and all that, God forbid, there's some that that didn't make it, but a lot of the people here in Chigo, man, they jog and they're healthy. But still, it doesn't matter if you're healthy. Sometimes it just catches you, but you have to go through the testing and go through the treatment and just watch it and get it over with. Because if there's some that are not going to make it, okay, might as well get it done and get it over with.
But Mayor, when you spoke with Melissa Savaris, did she say that when they do the testing in Jigo, it's going to just be for people who have symptoms or people with most vulnerable populations? It's for everybody.
It's for everyone.
Okay.
And man, I just hope that people are thinking, and just about everybody's scared, okay? But what are you going to do? Be scared for the rest of your life and hide and not get tested? That's a bad thing to do. Most especially all these people, here in Jigo, they have families. They're living with their families. If you cannot think about yourself, think about your family.
Yeah. And there's a lot of people in Jigo. I mean, is this going to be more than one day? Because that just doesn't...
Oh, yeah, it should be. And you know what? It's not going to do us any good if we're gonna test half of Jigo and then leave. The best thing to do every time they test each village, and you know what? I think that they should start on one end, and if they start in Jigo, they just because you cannot be dumping from Jigo to Mariso, and how about while we're doing that, we're infecting Jigo again, and we're infecting Mariso. Just finish. You know what I mean?
Yeah.
Line by line.
I just don't know if there's enough test kits to test everybody.
Well,
and I know, and I wasn't sure if that. So Mayor Savaris told you it's for everybody?
No, she didn't tell me.
Oh, okay.
But I want my people to all get tested, most especially, and I hope all of them want to get tested.
Yeah.
Because it's no good if they just test some of them. Because, the people that are not going to get tested, we don't know who they are. They're going to be walking around and infecting everybody, that's even the ones that have been cured again. Unless if you get it and you get cured, you cannot get it anymore. But I don't think this coronavirus is that friendly. Maybe that friendly to catch you.
Yeah.
And we got to get advice from everyone, and I think that everyone that knows what they're doing, and I think that's very, very, very good advice, that when we start from Jigo, we finish everyone, and move forward, because it's kind of hard for for people to get infected if they're sweeping everybody line by line. You understand what I'm talking about?
Mm-hmm.
From Jigo, Dedido, and then Manila, everybody that's next. One thing about this, Kay, leaders should make decisions and stand by their decisions because they're responsible for the health of everybody here in Guam. So they might have to make hard, unpopular, but right decisions. And right now, I think that some of our leaders are salivating and making decisions, and they're not sure if they've made the right decision. And I think that the right decision is get everyone tested. Hey man, I got a lot to lose here, okay? I got a lot of family, and that's why I'm speaking up, because I'm speaking up for my family and my friends that believe in me.
I hear you.
Mayor.
We gotta move, man. We gotta move. I don't know. We have to be yelling about those test kits, and I, try to get the best deal. But to me, any deal is good to save the people.
Mm-hmm.
Any deal is good to save the people. And if we keep messing around, it's going to get worse.
Yeah. How are the people doing in Jigo? Are they, we're hearing about how we're hearing about people suffering out there?
And they're hungry, Mayor.
Well, I help every 11 o'clock. I go to FBLG and help pass out food, for the kids. And I see a lot of people, and some of them, it's just like almost any other day. But let me tell you, this thing is scary. I'm scared. But being scared don't make me be quiet. I want my people tested because that's the right thing to do. And this thing is gonna have to kill me for me to shut up. And I'll probably be rolling on my grave even when I'm dead. But I really think that it's the right thing to do, and our leaders should make a conscious decision, man, and the right one, and move forward and hurry up.
Got it, Mayor. I love getting you on the phone. He's a straight shooter.
Yep.
Shoot it straight.
Oh, dude, these kind of things, man, we should mess around, man. And hey, if I've made the wrong decision, then I'll stand by my decision because I think it's right.
But right now, I think you're making the right call. Get the people of Jigo tested.
Yeah. And hey, if people from Jigo wanna call me up and talk to me about this, hey, I'm very, very happy, man, because I've seen people scared, people mad, and when I tell them the truth, they're calmed down and they feel better. And maybe, hey, I welcome any of my people. I don't care who they are. I will be there for them.
Mm-hmm. What are they mad at?
Pardon?
What are they mad at? What are they mad about?
Well, I don't know in general, and that's just the way people are. But when you talk to them, I'm talking about my experience where they come in the office and they're yelling.
Right.
And then when I'm very excited to get those kind of people in my office. But when I listen to them and I talk to them, they walk out the office smiling.
That's good.
Mm-hmm.
That's good.
So, that's what I'm saying, okay? If people are mad, hey, let's talk. Maybe there's something that you don't understand. And if we both don't understand, we'll find the answers.
Yep, that's when you call KUAM, and we're going to get it for you, Mayor.
Yes, sir. Thank you.
Thank you, Mayor.
And I'm glad. Hey, Chris,
Yes.
Sabrina, thank you for calling me, okay, because I was just waiting for Dr. DeNorsi to let Mayor Melissa know when they're going to test, and I was going to go on the air, and I will still go on the air with you guys.
Yeah, we'll call you tomorrow. You let us know, Mayor.
My people, please.
Right. I'll text you.
And I hope that they're listening, and I hope they have a date for us.
And they don't, so that they're going to test Jigo. It's going to be a drive-through at the gymnasium, but there's no date yet, and we don't know how many people. That's all we know, people of Jigo.
Yeah.
Okay.
Hey, thanks, Chris.
Yeah, of course,
Thank
Mayor.
you.
Yes.
God
Okay.
bless you guys.
Wash your hands, huh?
Bye. All the time, even
Okay.
if I don't need to.
There you go. That's good, Mayor. Bye.
Bye.
947, Mayor Rudy Matanani. Of course, of Jigo, and feeling that frustration. We spoke with, Agate Mayor Kevin Siswico. The same thing with him. He said, hey, they said Sagambasita. It's not going to be a Sagambasita. Now he's got all the constituents calling him.
They said a couple of places, though, in Chico.
Yeah.
So this is just going to be in one location. Well, we don't really know for sure. But
yeah. And I think, going back to what Dr. Cabrera said is like, yeah, we want to know what's going to happen. But when they put this info out and you call the mayors and the mayors are like, hey, I just found out the same time as you guys.
Mm-hmm.
It's a little worrisome, and it gives the impression that they're going to say it. This is the reason or the excuse, depending on how cynical you are, that it's a rapidly evolving, unprecedented situation.
Yeah.
Okay.
And it is.
Yeah, it is.
It is.
But that doesn't mean that we get to be total idiots about it. 9:48. Hey, we're going to switch gears. How about we do a little something positive, Bree?
Hey, I'm all for that.
Are you sure?
I am.
Are you sure? Because you look like you want to still hammer on some... No?
Yeah, I'm not even like that.
Okay.
I'm a happy-go-lucky person. Just,
Right,
don't piss me off,
So we're going to go down south to my adopted hometown of Inarahan, where we're going to play this video here, and I'm going to get this up on my end, too.
Okay. So what is it?
Basically, what's happening is as we are staying home and kids are, trying to learn and trying to do stuff, what we're having is we're seeing, and it's not just Inarahan Middle School in this case.
A bunch of kids.
A bunch of kids, bunch of teachers all over different schools.
That's true.
They're really doing things to reach out to the students, whether it's through Class Dojo.
Yeah.
Or
Zoom class.
Facebook. A lot of these schools, they have their Facebook pages. Or Instagram. In this case, it's Instagram. And I just think it's really neat because, the teachers, they might not be in the classroom, but they know the kids are at home, and so they're just trying to bring the classroom to the kids. So I'm going to just play this little video here from the Inarahan Middle School Warriors family. Again, it's containing COVID, the KUAM News takeover of Guam's favorite Good Morning.
Hey, Warriors. So I'm here at home, just like you are. You've been spending a lot of time at home with your parents, and I'm also a parent. So what I think you can do to help your parents the most at this time is to probably, if you haven't already established a really good daily routine, wake up at a good time, and I know there's nowhere to go, but you could still be helpful with chores, and maybe cook something easy, ask your parents for guidance or to teach you your favorite recipes or family recipes. This is a good time, family bonding time. Yeah, so until next time, I'll see you later. Yeah, take care. Stop by the Grab and Go, get some meals.
Good morning, Warriors!
Buenas estudianti, na panmolikam do, mahalang do na amdo todo.
Buenas, my warrior family.
Half of the Warriors.
Morning, Warriors. Don't forget to get on your Moby Max, Moby Max.
Good morning. Stay home.
Such a cool idea, Marcella. Good morning.
Good morning.
And so how did you guys kind of come up with this? I know that maybe it was something where we're all staying home and, school is canceled. And like with my kids, it was okay the first, couple weeks. It was like, wow, there's no school. And then they started talking about their classmates. They started talking about their teachers. And was that kind of where you guys were coming from and putting these things out on your Instagram?
Well, what happened was we've been collaborating. So a lot of the administrators have still been hard at work trying to coordinate with teachers and counselors and our instructional coaches, and just trying to set up something on how we can reach our kids and get them to continue to stay active, stay educated, stay safe, stay home, do all of that, with the distance between us. So when we were having conversation, different schools were sharing different ideas, and I want to give a shout out to Astumbo Middle School because they were the ones that shared that their counselors set up an Instagram platform to share with their students. I'm a school guidance counselor, and that was one of the things that I was like, wow, that's something that we can do. And our students have a lot of Instagram. I know this because I have to deal with a lot of drama with social media when I'm actually in school. So I was like, we can actually use this to our benefit, and this can be something positive. And so I just took their lead and kind of said, I'm going to try that. I asked our administrator. He was like, perfectly fine, said, go for it, run with it. And so I've just been collaborating with the staff that have been doing the grab and learn, like Terrico Mansonia, our instructional coach, Brooke Camacho, our librarian, Lisa Castro. Like, I've just been trying to reach out to all of them. I get the message out on our chat, and then they send me videos and they send me things they're doing, cooking fried rice, making masks, just different activities. And now we're going to do our own grab and learn. So I posted that on our Instagram. I hope people get to see it. I think my biggest struggle is the students we're trying to reach are the students that don't have social media and don't have internet access. And so I was throwing it out to admin to have the different mayor's offices go around and inform the community when our grab and learn will be, and we're going to divide it by village. So it's not just going to be at our school, because even that is an issue. Transportation is an issue for a lot of our kids. So it'll be at the Mauricio Catholic Church, Califofa Mayor's office. Georgia will be Emu Lujan Elementary School and Inarajan Elementary School. And this will be on Friday, April 24th from 9 to 11. So, parents and families are encouraged to go out and come pick up learning packets that they can be doing at home for enrichment purposes. So, yeah, I hope that we'll get a good turnout.
Nice. I'm not sure how excited the kids are going to be to go pick up, homework and stuff. But I don't know. With my kids, they're kind of at that point where they've played. Like I said, they went through, done everything in the house. They could built all the forts they could build, and now it's kind of back to where they're yearning for that routine, Marcella. That routine you get from going to school, doing your homework, and I think a lot of teachers, make it fun, and that's why we're starting to see, especially the younger kids, elementary and, the middle school, they're kind of, I don't know, call me crazy. Maybe they're yearning for this instructional time.
They are. I think they are. And there's a lot you can do that doesn't have to do with just the traditional ways of learning. And so I guess that's what really it is. It's a paradigm shift in how we look at learning, right? So if you're cooking with your kids and you're doing measurements and you're doing, we're farmers. My family, we farm. So, if our girl's out there and she's watering plants and she's, doing that for her science, it's like that's what we have to do, and it stretches us. But I do want to say that social connection is necessary. So, if you can work with your kids to get connected, even if it's a phone call, calling a friend, asking them what they're doing, how they're doing, those things are important, especially for me. I work in the middle school, 6th through 8th grade. Like, it's all about their friends, and so using Instagram as a platform is really a helpful tool for us. I don't know what other ways other schools are doing it, but having the kids be able to connect. I mean, the kids are messaging our Instagram, telling us what they're doing. We all use Moby Max. Our school just implemented that this year under our principal, Derek Santos. And so it's an online learning resource that helps to fill in the gaps. So our students have actually been going on even before we were collaborating to say, hey, what can we do, so they have something to do. So it's really neat because they're contacting me for their passwords. They're letting me know that they're on it. They're screenshotting that they're on it and showing it to me. So I'm actually going to ask if I can feature them and show that they're doing MobiMax, and they are still continuing to because we had goals. I mean, this is a part of their goal was to increase their grade level performance in reading and math, and so they were already going every Monday, Wednesday, Friday, Tuesday, Thursday during lunch. You know, they were trying their best to increase their grade levels, and so they're still wanting that. They're still desiring that, and we've had I think our highest is 27% of our student population has actually logged on.
Wow.
And so that's a big deal for our school.
No, it is, and I know. I mean, it's a big deal for any school, Marcella. And I just got to say, middle school kids, they're at that place, they're at that crossroads where they're going to become young adults. They're going to go into high school. So I think it's really, I don't know, it's touching that you guys are doing this outreach for them.
Thanks. I do want to give a round of applause to our teachers and our administrators and downtown, just DOE and all together, you know, just in making the effort to do whatever we can do in order to support our students, because this is not, oh gosh, I'm sick and tired of hearing unprecedented times, but it really is. I'm like,
wait a minute, so it's getting to you too.
Yes.
Oh, I thought it was just us.
No, stir crazy. Yeah, no, that word needs to just. Yeah, I'm done with that buzzword. But really, it's true. You know, this is new to all of us, and we've got to help them get through it. You know, I keep seeing the seniors. I cry for them because, man, it's a very different senior year for them. You know, the missing out on things. It's you know, I'm sorry, I'm just going to do a little plug, but I'm also a grief recovery specialist, and so just the idea of the losses that our kids are going through at this time, right. It's just crazy. I want to give them all a virtual hug, and so I'll do that over the radio.
Let's go.
Virtual hug.
There you go.
Big ol' hug.
Right.
And telling you that, you know, we all want to support you, and though we don't understand your loss, and because we never experienced it, we respect it. We respect it, and we ask that all of our students and their families also honor and respect that. You know, like, don't tell them, oh, get over it. Don't tell them the things that we normally will want to say.
Right.
You know, this will pass, and don't worry. At least you'll have this to remember. You know, like those things aren't going to replace the feeling of loss that they actually are experiencing at this moment. I can't imagine.
Yeah, so, I got you. Thank you, Marcella. We're really out of time, but I just wanted to get you on. And, you know, hey.
Great job.
Great job to
Thank you so much.
You know, all the schools, the teachers who, you know, and I see
everybody
it.
At
I mean, you guys could just mail it in and just say, oh, you know, hey, we're not working. Like I know some government Guam employees are doing. So I just want to commend you guys for continuing to be in these kids' lives. And we got to run. Marcella, thank you so much.
Thank you. Thank you guys for having me.
Okay, Esther, wash your hands. There you go. That's our COVID hero for the morning. Okay. Hey, guys, KUAM TV 11, thank you so much for watching.
Bye.
All right. Yes, bye. We'll see you guys there. We're going to wrap it up here on the radio again. Bree, good job today.
You too. And Joseph.
And Ken Nicholas from our digital team. Again, it's been another containing COVID.
We're going to try and get more information to you about the testing that's going to be at Stumbo this Saturday from 9 a.m. to 12 p.m.
We will get that information.
But the new message is...
Get tested, get tested, get tested, get tested. It's free. No insurance, no problem. All right, there you go.
We'll see you guys tomorrow.
Yep, for Sabrina Salas Matanani, Gualhusi Chris, Esta Ajo.
Bye.
Be healthy. Be informed with ITD.